open it up to public comment, and then the board can discuss, or would you prefer the board can have a brief conversation first, which may guide some public comment, whichever you would prefer?
I'll move.
Mr. Chair,
Reverend Gold, we've got a motion from Mrs. Foreman.
is it on this? I'd like to make a substitute motion or amend this motion.
Why don't we do a motion to amend?
All right,
Either way.
okay. I'd like to amend the motion.
Reverend Golden, we need to get a second
Hasn't
first.
been seconded.
Oh, okay.
Okay, I'll second it. Go ahead, Reverend Golden.
All right. I move that the motion to direct the superintendent to implement a mask mandate for all students and a mask mandate for all employees and adults on campus through August 25th, 2021.
Do we have a second to that motion to amend?
I'm sorry, I was reading that word for word almost. What's the difference?
No opt-out. No opt-out
Oh, okay.
provision. It would appear that the language that we are committing to abide with in the local school board is language that was handed down to us via the Department of Health, via the Department of Education from the governor. And I know that I am an ardent supporter of local control of school boards. And I don't want to give any impression whatsoever that I'm ceding that authority this year under better situations than we had last year. Everybody seems to be so focused on opt-out, 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 that we're losing sight of the fact that all of this language comes to us from the governor. And so I'm not supportive of an opt-out provision because it takes away from local authority and local control.
Reverend Golden, that motion, having heard no second, that motion is going to fail for lack of a second.
All right.
I have an amendment I would like to make, but I'll defer to the board first. Okay, I'd like to make a motion to amend to read, motion to direct the superintendent to implement a mask mandate with opt-out provision for all students. I would strike and a mask mandate for all employees and adults on leave campus through August 25th, 2021. I'd like to make let me just try that. Motion to amend to read, motion to direct the superintendent to implement a mask mandate with opt-out provision for all students on campus through August 25th, 2021.
Are we able to make a change to it as we discuss it, or can we break this out into two motions to discuss them separately?
What I would suggest, and Mr. Dye can back me up on this, is that we can vote on this motion to amend that I just gave, and then if you'd like to make another amendment after that, we can vote on that motion to amend.
Okay.
All right? Do I have a second for my motion? Okay, that motion fails for lack of a second.
Okay, then I'd like to make a motion to amend to change the emergency action item to motion to direct the superintendent to implement a mask mandate with opt-out provision for all students through August 25, 2021, and then add a second motion, motion to direct the superintendent to implement a mask mandate for all employees and adults on campus through August 25, 2021.
Okay, that's two separate actions. So
Yeah.
So let's do one at a time.
Well, I'm amending the agenda.
We're on this motion right now.
Okay.
So do you mind splitting that one out first?
That's fine. Yeah, okay.
So do you mind restating? So
Okay,
we're clear.
just guide me along, and I'll, you know what I'm trying to do here.
I do. I think the first part of what you're trying to do is exactly what I was trying to do.
Okay,
So you want to try that again, the first part?
Sure. Motion to direct the superintendent to implement a mask mandate with opt-out provision for all students on campus through August 25, 2021.
I'll second that. We have a motion to amend with a second. All those in favor of
I
amending?
have a question
Yeah, perfect.
to the attorneys. There was a motion made, exact same motion, that died for the lack of a second. We now have another school board member that's making the same motion that has been seconded by the person who made the first motion that died for a lack of a second. Is that proper?
I think because she combined it with two motions as a package, it's proper.
Okay,
The first one did not have the second
okay.
aspect to it.
But she has not made a second motion. As a matter of fact, at the direction of the person who made the first motion, she has been instructed to not make the two motions together. So I'm trying to figure out how one stated motion of exactly the same measure dies for the lack of a second, and then the second motion made by someone who wouldn't second the first motion, at the direction of the person who made the first motion, is now able to make that motion.
Because she broke it up into two different ones.
But she hasn't done that. That's not.
I missed that. Could you restate, Ms. Foreman, what your two motions were?
I would like two motions.
Okay.
Okay. I was instructed by the chair to do them one at a time. I'll do them both here. First, motion to direct the superintendent to implement a mask mandate with opt-out provision for all students through August 25, 2021. Then motion number two, motion to direct the superintendent to implement a mask mandate for all employees and adults on campus through August 25, 2021.
I would rather you combine that into one motion.
Which is what we have.
Which is what we had. Right.
Okay.
That's what I thought. Yeah. So, at this point, all we have still before us is this motion. Three motions that have already been made that have died for the lack of a second, or that were put forth in an improper order.
Okay, anybody want to try again? Folks, we have to strike the mask mandate for all employees. That has to go.
Correct.
If I need to make a motion that's different than one that was previously made, let me try again.
I'll try.
Go ahead, Riff.
That we direct the superintendent to implement a mask mandate that is consistent with the recommendations of the Department of Health and the CDC for all students on campus through August 25th, 2021.
Does that contain an opt-out?
No, it doesn't. And for the record, I'm just going to keep trying to make a motion that does not contain the opt-out, because I think we are about to become a part of a political process that is ongoing all across this state. We're not the only ones meeting today, or that met last week, or that's going to meet tomorrow. And I'm just saying that we need to stand and draw a line in the sand. I'm not going to play politics with something that we all acknowledge brought us through last year.
Okay, Reverend, I'll give your motion a second
Thank you.
to see if there's 3 votes for it. So we have a motion to amend to direct the superintendent to implement a mask mandate which follows provisions of the Department of Health, Department of Education, and the CDC.
No, I didn't say the Department of
Oh, sorry,
Education.
Department of Health and CDC
That's correct.
through August 25th, 2021.
That's correct.
Okay, we have a motion and a second. All those in favor, please say. Oh, sorry, Ms. Messenger?
Hold on. The Department of Health says in the emergency rule they gave us that cites law that says that it cannot be mandated. And it says in the Department of Health's emergency rule that they must be optional, or that there must be an opt-out. It says there must be a choice and there must be an opt-out, and cites state law that says they cannot be mandated. So is that what you're referencing?
No, first off, it doesn't cite state law. What the Department of Health rule cites is the governor's executive order.
No,
And
at the top of it, it does cite the state law. It cites the state law about the parental bill of rights. At the top of it, it does. And it says that according to that law, you cannot mandate masks.
And the parental bill of rights that we are discussing here is specifically charged with being implemented by the local school boards. That's why each school board had to adopt them. The parental bill of rights had to be adopted and put forth by the legislature. You're absolutely right. The legislature says that. But there is nothing in the legislation or nothing in the legislature that directs or usurps the authority of the local school board to make decisions on the basis of what's best for that local school board. Not even the parental bill of rights.
I agree with that. However, part of the basis of what they created, both the emergency rule for the Department of Education and the Department of Health, their basis for both of those was the parental bill of rights, because they believe that the parental bill of rights does prohibit a local school board from mandating masks. Now, that might be their legal interpretation, and that is fine, but when you have two major agencies from the state of Florida stating that, then my question is, what do you mean by following their rules? Because to me, their rule was very clear. So what I'm trying to understand is what you mean behind this motion, I guess.
What I mean behind this motion is that I do not believe that the parental bill of rights is designed to overcome the decision of this board to make a decision in the best interest of all of the children. This is not an individual rights issue. This is not a constitutional issue. This is not a...
Folks,
I'm
I'm
not-
going to issue my warning to the room. Any outbursts from the audience, I will ask the Bradenton Police Department and our security team to remove you from the room. You're going to hear things you disagree with. Please listen respectfully. We will listen to you respectfully when you step forward to speak. Everyone in the room has been warned. Any other outbursts, and you're going to go. Reverend Golden.
And even if the Department of Health makes that recommendation, it does not supersede the recommendations that have been made by the Center for Disease Control. This is a national pandemic, an international pandemic. And so I am trying to disengage all of the political talk from the health issue that we decided purely on the basis of health last year. Last year we had no vaccine, and there was no talk of mandate, no talk of parental bill of rights, no talk of any of this. Last year we implemented a mask mandate that was accepted, embraced by everybody in this county. And now this year, all of a sudden, I'm hearing all kind of talk about parental. I got rights too. I have a right to not be infected by your child who does not have a mask, or by a teacher who refuses to get vaccinated. And at some point in time, we have to separate the wheat from the chaff. This is a serious health issue. Children died last night and over the weekend. And I'm not for that. I'm not playing any more games with respect to that. So that's my motion, and I stand by it. I don't interpret the law the way the attorneys for the Department of Health and the way the attorneys for the Department of Education seem to interpret, and maybe even our own attorneys. I have a law degree too, and this is not a constitutional law issue. This is a public health issue.
Reverend Golden, Mr. Dyes has been waiting to speak. And then I'd like to vote on this motion.
Thank you, Chairman. I think persons can interpret the recommendation of the CDC and the Florida Department of Health as conflicting. I think the board would be better to be specific in its action for the benefit of the parents and the superintendent in carrying out anything.
Thank you.
So that's my recommendation.
Okay.
Fine, then I will amend my motion to exclude a reference to the Department of Health or the Department of Education, and I will rely on the recommendation from the Center for Disease Control, which is a federal agency that supposedly sets policy for everybody in the country, not just people in Manatee County.
Okay.
Now, you may not want to second that, since I've excluded the Department of Health and the Department of Education, but I do strongly support the recommendation of the CDC, because that's what we used last year. We used that last year.
Okay, I will still second your motion.
Thank you.
I'm actually going to vote against it, but I think to be clear, to keep the record clear and the minutes clear, let's vote on it, and then let's try this again. Okay, so if we could please voice vote. All those in favor of Reverend Golden's motion to amend, please say aye.
Aye.
All those opposed, please raise your hand. Say aye. Okay,
Aye.
motion's going to fail. 4 yeses, excuse me, 1 yes, 4 noes.
I almost pulled it off.
You would have liked that.
I almost pulled it off.
Okay, let me, I could try this again, and when I get to a chance to address this, if this motion passes, I'll tell you why I'm doing what I'm doing. Oh, Mrs. Foreman?
No, I'm just laughing. We're almost to the point where we've got to adjourn the meeting and try again tomorrow, you know?
No, we're not doing that. Okay, board members, I'd like to make a motion to amend the agenda, to amend this item, to read, motion to direct the superintendent to implement a mask mandate with opt-out provision for all students on campus through September 14th, 2021.
September 14th?
September 14th is 2 board meetings from now.
I'll second that.
Okay, we've got a motion and a second. Any discussion of amending the agenda? Not the relevance or the merits of the item, but amending the agenda.
Well, I don't see anywhere on here where we are there's no approval of an agenda on our agenda.
I'm
So it's
making a
just
motion to amend the item.
the item, okay.
Okay, if we could please voice vote and raise your hand. All those in favor of the motion, please say aye and raise your hand.
Aye.
Aye. Okay, all those opposed, please say no and raise your hand.
No.
Okay, that motion fails 2-3. Somebody else want to try?
We're throwing motions out. I'll make a motion.
Mr. Cho, it'd be a motion to amend the item we have to make it, unless you want to do a substitute motion, which certainly works too.
I'll make a substitute motion. To direct the superintendent to continue the provisions we have in place with parental choice on masks.
I'll second that.
Okay.
Throwing out motions.
That's fine. No, it's okay.
Like all we're doing.
Motion for the status quo, but, okay, all those in favor, please say aye and raise your hand.
Aye.
All those opposed, please say no and raise your hand.
No,
Motion fails 2-3.
it didn't pass 2 to 3, it failed.
Isn't that what it
It
said?
said passed.
Did I say passed?
Yes, you did.
Thank you, Ref. Motion failed.
But all right.
Okay, we have we got to get rid of that mask mandate for the employees, and I apologize for the confusion I created on Friday for including that, because that is a bargained item with our unions. Reverend Golden, I admire your desire to engage in the legal fight and defend our local control. What I was after here was something that a board majority would support. I'm not sure a board majority supports the entering a legal fray against the governor. So I'm not sure what we're left with. So what we are left with now is the motion as it reads, a motion to direct the superintendent. Oh, I got an idea. How about this? Motion to amend, board members. Motion to direct the superintendent to implement a mask mandate with opt-out provision for all students, and to begin discussions with our collective bargaining units on a mask mandate for all employees and adults on campus through August 25th, 2021. Have a second?
I'll second it.
Okay. Mr. Dye, is that motion proper?
Can you restate it, please?
Sure can. Motion to amend the item to read, motion to direct the superintendent to implement a mask mandate with opt-out provision for all students and to enter discussions with our collective bargaining units regarding a mask mandate for all employees and adults on campus through August 25th, 2021.
Yes, I think you can proceed. I've got an idea for one if it doesn't
Okay,
pass.
we might need it.
That might be better.
Okay. We've got a motion and a second. I think we're discussed out already. If we could voice vote again, please. All those in favor, please say aye and raise your hand.
Aye.
Aye. All those opposed, please say no and raise your hand.
No.
No.
Motion fails 2-3. Mr. Dye? And if this doesn't work, I think we can wrap it up.
What I'm suggesting is you modify your motion where the opt-out is also for the employees. So mask mandate for everybody with an opt-out for everybody.
Mr. Dye, that would still be, I believe, that strikes me, that would still need to be a bargaining item because it does deal with,
But you are in an emergency and it'd be limited time duration.
is limited time, and they do have the opportunity to opt out.
And as Reverend pointed out last time around, it was mandate for everybody, regardless of the bargaining agreements. So,
Okay. So, but that's the key, because we are in emergency status. Okay. Let me try again. Motion to amend the item to read, motion to direct the superintendent to implement a mask mandate with opt-out provision for all students and mask mandate with opt-out for all employees on campus through August 25th, 2021.
one other suggestion, I should have made this earlier.
Yeah.
I think it would be important for the board to just recite that it finds that the emergency declared by the governor and the Department of Health and Department of Education is the basis for this rule in Manatee County.
Okay.
Say that, okay, wait a minute.
Finding that we are in an emergency.
By the Department of Health and the
No,
governor's
okay,
office.
not that we adopt
No, we're
the
just,
governor's executive
we're
order.
finding that we're operating in the emergency that's been declared by the governor, the Department of Health, and the Department of Education,
And the CDC.
and the CDC. But
Although we're governor under the Florida Constitution.
yes, it's more important that we tie into the emergency that was declared by the governor and the Florida Department of Health and Department of Education.
Okay, I'm gonna withdraw the motion I just made. Mr. Choate.
Gina had her hand up first, or Miss Messenger, sorry.
It's okay. I was just going to say, I see no difference between that motion and the motion Mr. Choate made. There is no difference. Whether you say it's a mandate with an opt-out, or we're going to continue what we're doing right now where everyone has a choice, it's the exact same thing. It will be treated the exact same way. So I do not see a difference between his motion and that motion. But it didn't, but
I withdrew mine anyway.
you withdrew it, so it didn't matter.
Mr. Choate.
If you withdrew it, then there's no more questions.
Okay. Let me try one more time. Motion to pursuant to the emergency
Yeah.
declared.
Let me make a recommendation. Because obviously we are not trying hard enough and we're not good enough to solve this amongst the five of us. I think that we ought to move to public comment.
Absolutely not.
Yeah.
Absolutely not.
Well, I'm just saying, it seems like,
I wasn't mid-sentence, so if I could. if I
yeah,
could finish my-
I'm sorry.
Okay, repeating. Pursuant to the.
Chairman, point of order. Sorry, the governor actually did not declare an emergency, so it was just the Florida Department of Health.
Okay, thank you. Cross that off. Pursuant to the emergency declared by the Florida Department of Health, I would like to make a motion to direct the superintendent to implement a mask mandate with an opt-out provision for all students and employees on school campuses through August 25th, 2021.
I'll second.
Okay, we've got a motion and a second.
I've been on readiness.
Reverend Golden?
Yes, I'd like to ask the attorney, did the Department of Health emergency order respond with a mandate with an opt-out provision?
They did not use the word mandate. They said students may wear a mask, but said that you can opt out from having to wear a mask. So it was not the word mandate.
Okay, we do have a motion and a second.
So my thoughts on your motion is we're voting on something that we don't even know through negotiations. Is this something, and I guess, I mean, it goes back to Mr. Dye, I know he thinks it's okay because an emergency was declared but it wasn't declared by DeSantis. It was, so are we setting ourselves up for something with concerns to our bargaining that we've already bargained? I don't want to move it. I don't want to vote on a motion, move it, and all of a sudden we're stuck in some battle to where we have a breach of a contract.
Yeah, Mr. Chair, let me address that. What I'm intending to do with this motion is a couple things. Adhere to the governor's executive order and then further through the emergency rules set by the Department of Health a week ago, last Friday. So as much as I would like to enter into that legal fight with Reverend Golden and other counties around the state, I don't think that's our best course of action. I am also, and I said this last week, is the reason, and I said this last Monday, having optional masks or an opt-out provision is really the same thing. It's a distinction without a difference, I think is the word I used last week. But what we saw last week is that counties that do have the opt-out provision are seeing much higher rates of mask wearing. And so that's all that I'm after. I don't want to mandate that anyone do anything. I want to let parents decide for their kids what they want to do. But apparently there's a great group of people in the middle that will do what the school board and district guide them to do. They will listen to our guidance. For those parents that want to opt out, they will still have that option to opt out. It is just that I think our campuses are safer if that vast majority of folks in the middle will take our advice and say, well, if the school district wants me to wear a mask, I will. That's all I'm after.
And the superintendent recommended that already,
Okay.
right?
Excuse me.
That's what was
Are you
just
asking me a
done
question?
last week.
It was strongly encouraged. It did not say mandate.
No, I know it didn't say mandate.
Okay.
But my motion does say a mandate with an opt-out provision. I see exactly where you're going. It's, Gina, Ms.
Okay,
Mester.
in your motion, you're citing the Department of Health as the qualifier for, using this emergency procedure. But as our own attorney has stated, the Department of Health's emergency rule, which you're using as the qualifier, does not say mandate. But the motion you're making says mandate. I know that there are counties that are reporting in newspapers that those percentages are a certain percentage. Those are not accurate percentages. As I said before, parents can choose to not fill out a paper and just send their child. So those percentages that we're hearing are people that are choosing to fill out a paper. Does not reflect what's really happening in the classrooms. Second of all, those counties, the counties that are doing that are not the same demographics as our county, and you know it.
I sure do.
So those counties, they probably already had that as a reflection in the entire county. You are not going to change that by changing one word. And what it sounds like to me,
I'd like to try.
yeah, but I'm going to tell you how it sounds to me, and I think to other people, is you're hoping that you can trying to find a nice way to say this.
I would say strongly encourage through a mandate with an opt-out. That's what I'm after.
But what that looks like is you're trying to manipulate people into doing it, and you're hoping that they will not get educated on their choices. That's how it comes across.
That's not.
I don't think that's your intention, but I think that's how it will come across, is I'm hoping to manipulate you into doing it because you already had the choice, and we're not changing anything. We really can't change it, as you've acknowledged. We really can't change it, and I do not see the point in taking up a legal fight. I agree with you. We really cannot change that. Truly, if people are unhappy, and I understand there are people that are concerned, the best way to make those changes is to join the legal fight that already exists fighting it. Contact your legislators that are being cited. The law is being cited as a reason. Contact your legislators and tell them how you feel. They can change the law. We cannot. Contact the Department of Health. They can change their emergency rule. We cannot. Contact the Florida Department of Education. They can change how they proceed. We cannot. And the people that are taking up that fight are parents. I respect their right to do that. But this, I do not see changing anything except for changing one word, and that one word is not supported in the emergency order that you're citing, that you're using to make this motion. And our own attorney says that. So I don't see the difference. I don't think you're going to get the response that you think you're going to get. I understand why you want to do it, but we are not Hillsborough County, and we are not Orange County. We are not Broward County. So we're not going to get that same response. And you can see it by how our community is now versus if you went to Hillsborough County. If you went to Hillsborough County, you would see mask usage, I'm sure, at a much higher rate.
Okay. You good? I want to stop you.
Yeah, I mean, I feel like now we're arguing the merits of your motion when we haven't even voted on,
That's where I was
you know, but it's just,
That's where I was going to. As I said last week, though, I don't, the politics of what this county looks like versus other counties, I just think this is the right thing to do. I don't really care what the politics are, or the demographics are. We've got a motion and a second. Let's vote. All those in favor of the motion?
I'm ready, Mr. Chair, and I know you can see that I'm lit up to speak.
Oh, actually, I didn't have it up on my screen, I'm sorry.
That's quite all right. I understand.
Reverend Gold.
First off, let me correct a misapprehension that people have. I am not interested in engaging the governor in a legal battle. I'm trying as hard as I know how to avoid that. And the reason I think that the motion that we are about to consider containing the word mandate is because all we're trying to do is to give the superintendent direction until some of the other things that Mrs. Messenger talks about comes to pass. It takes time to pass legislation. It takes time to get hearings in courts. It takes time to make final decisions. But we have no time to not make a decision that's in the best interest of the people in this county today to help us to get to August the 25th. That's what this is directed to. And what I'm hearing us break down into, let's do nothing until August the 25th. And then, as they say in politics, kick the can down the road then too. Or we can do something now predicated on the survey that we have already approved and it has already gone out there. We are trying to find out as best we know how as to just what the sentiment is of the parents. That's the motion that we made with the survey. We're trying to find that out. But while we're trying to find that out, children and people are getting sick and dying. And if we don't stand for something, then we'll just literally fall for anything that comes before us. And I'm suggesting that at this point in time, the difference between the language of a mandate, which may or may not be consistent with the language of the Department of Health, it is the Department of Health's order is the closest thing that we have to hang our hat on as it relates to this health crisis. Because that's all this is. It is a health crisis, made worse so from last year, because children under 11 in this county do not have any protection against the variant. And I understand now there's a variant of the variant, and we've got to do something to protect the health of people. With respect to whether this is a bargaining issue or not, even if we say this in that, then that becomes opposition for bargaining, that we would like the employees to join us in abiding by the mandate with the opt-out. It's no different than the children that we are asking to join us in this mandate with opt-out. Yes, the language is a mandate. I don't know how much more important of an issue we can have to mandate than the very lives of the children and the families that we serve. Because one thing is absolutely sure. If we do this and we don't need it, nobody dies. But if we don't do this and we'll have needed to do it, I don't even want to think about those consequences. And that's not opinion or hyperbole. Death is one thing for sure, permanent. And now they're all finding all kind of other ramifications in terms of mental health of children and how that's impacted when they grow up and go forward, things we don't even know about. And we're sitting here talking about our liberties. Trust me, I know about liberties being taken away. And I know about segregation. I know about that personally. And what it means when the government doesn't take any action to help you with that. So I will support this motion to the 25th because it gets us from today to the point of time where we will have a survey completed and where we will know what the parents in this community think, not just the parents in the room.
Okay.
Can you repeat your motion?
I'm going to let Mrs. Foreman speak, and then I will.
If we're going to discuss the motion as opposed to the merits of the motion, I will wait on my comments.
Okay.
Okay. The
I think
motion.
Ms. Messenger had her hand up, Brother Chair.
I just had a question about something that he made a comment about a survey. So the survey that you proposed was, I believe, asking preferences. I
Yes.
prefer
Yes.
if my child is in a masked classroom. I prefer if my child is not in a masked classroom. I have no preference.
That's correct. Yes, ma'am.
Is that my understanding of your
That is
survey that you want to send out?
Yes, ma'am.
So my question would then be, let's say a majority,
Can we save this until after this motion?
sure, I just
I
want to
think we need
understand
to-
what his point of view is on the survey.
Yeah, but that's not part of the motion. So can we
Sure.
dispense with this and then deal with that?
That's fine. I don't have any, either way you want to do it, I'm prepared to discuss that. If it will help clarify where we are in terms of preferences, I'm simply saying that in talking with Attorney Dime, I'm not looking to ask people who don't want to or who prefer to not to wear masks, not asking them to do anything. All we really want to do is try to figure out how many people not in the room would really prefer to have their child in a class with a math teacher, because I think that will drive the ultimate decision that we're going to have to make, and that is whether or not this mandate goes beyond the 25th.
Ms. Foreman, ready to speak? Reverend Gold, my only caveat with that is we've been told by the state that we cannot segregate kids.
I understand that too, but that's a legal opinion.
Okay.
First off, there's no protected class of mass people. The laws of segregation in federal courts are for protected classes. You don't just proclaim yourself to be segregated against.
You're going down that legal road.
Yeah,
Okay.
that's all I know. You know, I try to keep hyperbole and emotions out of the decisions that I make in the best interest of the public. So when you sit here and tell me that you're segregated against, that's foolish talk.
Well, am I to understand we have 3 votes now for a motion to proceed with the discussion?
I think so, but let me.
Let's call, could we call that one,
Let me
please?
Mr. Choate asked me to repeat it. Motion to direct the superintendent to implement a mask mandate with opt-out provision for all students and to begin discussions with our collective bargaining units on a mask mandate. Oh, wait. I think with the employee opt-out, I took out the bargaining piece, did I not? I think I went 2 motions back. Yeah, let me repeat. From the top. Motion to direct the superintendent to implement a mask mandate with opt-out provision for all students and employees on campus through August 25th, 2021. That was the motion. That was the second. That's what's on the table. Are we ready to vote? Okay, all those in favor, please raise your hand. Say aye and raise your hand.
Aye.
3 aye votes. All those opposed, please say no. Raise your hand. Motion passes 3-2. Okay. So just to repeat for everyone who's listening or in the room, this is a motion to direct the superintendent to implement a mask mandate with opt-out provision for all students and employees on campus through August 25th, 2021. We have a whole bunch of public comment.
You have a list for public comment?
I've got it on my screen.
I see. Oh, it's contraption here.
Amanda's coming around.
Usually I get a piece of paper, but I guess they're trying to bring me into the 21st century, the 20th century. And this one has Roman numerals on it. My goodness. I don't know. Let me see. I, 2, 3 I's.
Your paper's good.
Okay.
Mine just switched over too.
Oh, my goodness.
Okay,
Okay, 3.
we will begin public comment now because I would imagine that almost everybody here is, we have 43 people lined up to speak. Before we begin public comment, Reverend Golden, I'll have you do your spiel for the have you do the instructions for the public, and then before we begin public comment, I'll repeat the motion one more time.
All right. Thank you, Mr. Chair. And before I begin reading the public comment, I would like to point out that we have 43 public comments. If we adhere to our 3-minute rule, that will be 129 minutes of public comment, which is 2 hours and 9 minutes. Is there a sentiment, an appetite to modify the timeline for public speaking?
I'm usually leery of this with the number of comments we have and the nature of the motion we have. I wouldn't, again, if there's any outbursts, you will be asked to leave. You will be escorted out. I would suggest maybe we go to 2 minutes per comment. This is our 4th meeting on this topic. I'm just one person, folks, and please settle yourself down so you don't have to leave.
Respectfully, I actually agree. We have had over 2 hours of public comment about this exact same topic on Monday, 1 week ago. And a lot of the people that are signed up are people that were there before. And so I would prefer that we make sure that Mr. Choate has already said he needs to leave at 11:30. I'd rather make sure that we get to a point where we can have a real vote with the entire board here. And if that means we follow what other boards have done, which is limited to 30 minutes, or shorten the time for this meeting so that we can ensure that the entire board is here so we have a full board when we vote, I would much prefer that.
It's 2 minutes, okay?
I want to be fair about it. I want to ensure that the entire board is here when we have
Sorry, I
that
should have
discussion.
said 2 minutes, then would reduce it to 86 minutes, which makes it an hour and almost 30 minutes, I think. So, and does that help with, because,
My personal opinion on this, and I know you're trying to make it for me too, I would prefer this is something that's done before the meeting to let people actually know, hey, we're reducing 3 to 2 or to 1 or only 30 minutes or whatever, however, I know the county commission does it different ways. I don't necessarily like us doing it now just because we have a certain amount of number. I'll stay if I gotta stay. I mean, so, you know what I mean? That's not making my decision. So I would prefer us to talk about this. I do think it needs to be discussed how to move forward in later times. I don't know if right now everyone's come here and they expected their 3 minutes.
Fair enough.
I'm in
That's
forward.
they knew what it wasn't announced ahead of time.
Okay. So 3 minutes, 3 minutes. Reverend Golden?
I'm simply saying, you don't know how many until the list is presented to us. So I don't know how we can determine ahead of time how much time we're going to allow. But I do agree, since I've now heard from Mr. Choate that he doesn't have to leave and that he's willing to stay, that perhaps the better course of action would be to go ahead and allow everyone the opportunity to be heard. I ask that just because of this, and the people need to know what the thinking and the sentiment is. And I believe that now that Mrs. Messenger has heard what Mr. Choate has said, I think that the 3 minutes, I would go along with that. So
3 minutes it is.
is that, okay, thank you. Now can I read what did you say, what is it, spiel? What is that?
Instructions. I corrected myself to
Oh,
instructions.
okay, all right, okay. Oh, Lord have mercy. Public comment is not an open forum to discuss matters unrelated to education, to support or to oppose candidates for public office, or to engage in commercial speech attempting to sell a service or product to the school board or public. Also, public comment is not a forum to attack individual school system employees or board members. Any such complaints should be submitted in writing to the superintendent for appropriate handling. Finally, this is not a forum for addressing issues involving individual students because of privacy concerns. Such issues should be submitted in writing to the superintendent for appropriate handling. Each speaker is allowed 3 minutes to address the board. Speakers must stand at the podium and not approach the dais. This is a business meeting of the school board, and the public expects that we conduct it in an orderly, effective, efficient, and dignified manner. We request that speakers keep this in mind when making your comments. We also request that the audience keep that in mind and not demonstrate approval or disapproval of what a speaker has said by clapping or booing. The board appreciates the public's input and will listen attentively, consider each comment, and usually will not respond, enter into debate, or answer questions during comments on agenda items or during the public comment section. Before you begin speaking, please provide any handouts to the agency clerk. Please identify yourself only by your full name for the record. You have no more than 3 minutes to speak. Please stop speaking when the bell rings. Florida law requires all citizens to conduct themselves in an orderly fashion at public meetings. Any individual who interferes with the expeditious or orderly process of a school board meeting will be subject to removal from the meeting pursuant to section 1001.372 paren 3 Florida statutes at the discretion of the chair. Orderly fashion is deemed as, at a minimum, 1, no profanity, 2, no vulgar language, 3, no discourteous, disrespectful, or disparaging conduct. We have 43 names, Mr. Chair. The first name, Nicole Lynch.
I'm sorry, point of order first. First you were gonna read back the
Oh, the motion. I'm sorry.
motion, and second, I just want to clarify, are these comments restricted to today's motion?
Yes.
These are comments just on the motion. If anybody, thank you, Mrs. Foreman. If anybody would like to make a general public comment, just please let us know, and we'll drop those to the end. Public comment right now is just about this motion, which is a motion to direct the superintendent to implement a mask mandate with opt-out provision for all students and employees on campus through August 25th, 2021.
Can I call the first name?
Yes, sir, which you did.
Nicole Lynch.
Good morning, everyone.
Good morning.
Good morning.
I would like to first discuss that segregating our children based on their parental choices of mask wearing or non-mask wearing is wrong. Whether you identify it, Reverend Golden, as segregation or not, that's exactly what you're doing. The actual definition of segregation, the action or state of setting someone or something apart from other people or things, or being set apart. And that's exactly what you're trying to do by putting out this survey of whether we want masked classrooms or not. It's disgusting. However, making teachers wear a mask after you've highly suggested that they get a vaccine, that alone, you've already acknowledged you cannot make your teachers wear masks. It's wrong. It goes against the union, and they've already said that. So I don't even know why we're up for discussion. You put up 6 different motions this morning, or more, without public comment. Like, how many times are we going to go over again and again without letting the public speak? And then you try to limit our time speaking. We listened to the rambling on about the same motion this morning for 50 minutes. And again, these people are taking time off work. Let's talk about the quarantining of kids. In this whole, whether they're masked or not, you're wanting to quarantine them. And who's gonna pay for the parents who are taking off work when it comes to quarantining their kid? Are you gonna pay for them when they lose their job? Are you gonna hand over your paycheck for that parent to feed their kids? Who's gonna be responsible? Because a lot of these working parents, they can't take that time off work every time a kid in their kids' class has to quarantine. We had, and then let's talk about the contact tracing. No one in our kids' school got COVID last year through contact tracing. We had 13 cases, not one kid got COVID from someone else in school. We know that every mask that every one of you are wearing right now does absolutely nothing. Unless you're wearing N95 mask, those masks are useless. And the masks the kids are wearing in school are useless. What we're talking about is pointless. Those masks that the kids are gonna opt in to wear, they're not gonna do anything. They're not gonna stop the virus. They're just making people feel better, making people feel safer, and that's a false sense of security. As far as the quarantining and the mask wearing, we need to just let parents have the choice. Whether we're opting out or not opting out, making a mandate is only making people feel better. Like you said, it's a manipulation. It's the exact same thing as what we're doing right now. You're just hoping that someone will comply with what your agenda is, what your agenda is, what your agenda is.
Thank you very much. Kathleen Flora. She's on the phone, Mr. Chair.
Just, Reverend Golden, 1 second. Just a word for, if we could stick to the motion itself, just for every reason, our quarantining rules were set by the Department of Health 10 days ago. So the state took that out of our hands. So just want to clear that up if there's any confusion. Ms. Flora, if you're on the phone, please press *6 to unmute. Ms. Flora, please press *6. Okay, Reverend Golden, let's move on.
David Laurie Dean.
My name is David Dean. I have 4 children in the Manatee County Schools. What this is really about is politics. The governor has placed you in between a rock and a hard place with the COVID mountain crashing around us. The politics of the governor with presidential ambitions, trying to out-Trump Trump by creating an issue that appeals to the COVID-denying extreme base of the GOP, who are anti-government, anti-science, and now even anti-society in their "I'm the only one who counts" attitude. Like a bunch of typhoid Marys, they demand the right to get infected, spread that infection, and stop any protective measures for anyone else to boot. There are only 2 choices. Do you comply with the reckless executive order and the implementing rules of the political agency heads, or do you protect our kids and comply with the CDC guidelines and orders? The governor has chosen to disregard CDC guidelines because there's no enforcement mechanism. But he and currently you are also ignoring the CDC order that has the full force of federal law and can impose penalties up to 25% of all federal funds you receive. The specific order I'm referring to is that the CDC's February 1st, 21 order requirement for persons to wear masks while on conveyances at transportation hubs. The bus driver must ensure she or he boards only persons who wear masks. Public and private schools are specifically included in that order. Under the supremacy doctrine, where federal law overrides any state law, DeSantis' order and the state agency rules are illegal, and his toothless threats to impose sanctions against school boards that institute mask mandates can and should be safely ignored. Just yesterday, the federal DOE sent a warning letter to FDOE, and the next step will be non-compliance notice and order before withholding federal funds through the TSA under 49 USC. I see by your proposed budget that you're counting on $97 million in COVID relief funds alone. So that's $24,250,000 that you could lose before any other federal education funds are included. Last issue in regard to the opt-out. Currently, without an opt-out, you don't really know if it's the student or the parents who have opted out of a mask. How many teenagers do you know that do every single thing their parents tell them to? My boys told me about other students whose parents are pro-mask, but as soon as they get to the bus, they take the mask off and stick it in their pocket. So without that written signature of the parent, you don't really know. It's not a kid's choice. Allegedly to the governor, it's a parent choice. So you need to get that information. And also, on that opt-out, you send to parents, it should include a notice that opting out on masks will mean the child will no longer be eligible for school bus transportation. That ought to result in many more masks being worn at our schools. And although I understand the teachers have bargaining rights, the non-bargaining leaders, it shouldn't be an opt-out. The principals and the leaders.
Yes, sir. Laura Anastasia.
Laura Anastasia?
Hi.
Oh, go ahead, ma'am. You have 3 minutes.
Sorry, can you hear me?
Yes, ma'am, go ahead.
Thank you. My name is Laura Anastasia. I have 2 children in Manatee County Elementary Schools. Thank you, Reverend Golden, Ms. Foreman, and Mr. Kennedy for pushing to put a mask mandate in place to protect our children. As last week demonstrated, parent choice is not enough to protect our kids and our teachers from getting sick. And as study after study has shown, masks do make a difference in reducing the spread of COVID in school. I am for all of you to please pass this mask mandate and to keep it in place until the community's COVID cases are under control and our hospitals are no longer overwhelmed with sick and dying COVID patients. Reverend Golden is right. This is an issue of public health, and during this health emergency, the health and well-being of all children needs to supersede the rights of individual parents. I am so tired of feeling like I am playing Russian roulette with my kids' lives every time I drop them off for school. Please pass this mask mandate. Our children and teachers' lives are in your hands. Thank you.
Thank you.
Thank you. Kristen Poncelet.
Ms. Poncelet, if you could press *6 to unmute, please. Ms. Poncelet, *6 to unmute. Let's just keep.
Kristen Poncelet.
Yes, can you hear me?
Yes, ma'am, go ahead.
Okay, hi, my name is Kristen Poncelet. I have 3 kids in Manatee County Elementary Schools. I wanted to say thank you to Reverend Golden and for Mr. Kennedy for fighting for the masks in our schools. I think
the last year's numbers of COVID cases in the first week of alone versus the number of COVID cases that we've seen in schools this week alone should be a huge eye-opener as to what works and what doesn't work in our school systems. Last year we had masks and we had safety protocols in place, and we had 7 cases in the entire week of school, whereas the first week of school with absolute none of that, we've got over 100 cases, and we've got families being quarantined, teachers being taken out of school. People are losing money, and they're losing their income, and they're having to take time away from work, and kids are losing out on education time. And why? It isn't because there is no virus and nothing's going on. It's because masks work. They help prevent the spread. It was obvious last year, and I don't understand why it's not being done this year, and why we're procrastinating on it. It's just meeting after meeting to talk about this, and meanwhile, the case numbers keep going up. The hospitals keep going. The hospitals just are getting overloaded, and you guys are just sitting around thinking about it, and what are we going to do, and what are we going to do? And you know what? Who's being affected? The community is being affected, and the kids are being affected. The first week of school is the funnest time of the year for all of our kids, and the majority of them are being pulled out of their schools right now to be in quarantine because they were exposed to somebody with a COVID positive child. And what could have prevented that? Masks and safety mitigation measures. So I hope that you guys get together and follow the recommendations of our local medical professionals and the CDC and put the masks in place. It is necessary to get the positivity rates down. Thank you.
Thank you.
Jessica Patterson.
Hi.
Go ahead, Ms. Patterson. 3 minutes if you need it.
All right, can you hear me? Okay.
Yes, ma'am.
All right, I just want to thank Reverend Golden for all your comments today and to fighting for all the children. We do agree everyone needs to be in masks in order to stop this. There's just a couple kids in our school. They have fevers. They wear masks, but most of the kids in their class do not wear masks. And now they have fevers and they probably have COVID because it is spreading. Everyone needs to wear masks in order to stop the spread. I'm just going to read a letter from the 12th Judicial Circuit of Florida that just came out first thing this morning from Chief Judge Charles Roberts. Recent increased cases of COVID have prompted the courts to again make some changes regarding face masks in the courthouses and hearing cases remotely. Our primary goal is to keep everyone in the courthouse as safe as possible. To further that goal, I recently addressed new mask requirements. If you're in the public area of a courthouse or court facility, you must wear a face mask regardless of whether you're vaccinated. These safeguards were implemented because of the exponential increase in COVID-19 in the circuit and all over Florida. The surges in Sarasota and Manatee are greater than the 7-fold increase in Florida as a whole. Florida recently reported over 21,000 new cases in one day, a new record since the start of the pandemic. In recent weeks, COVID-19 has variants are hospitalizing more and more people. On August 1st, Florida broke a previous record for current hospitalizations set more than a year ago. We also have recently an increased number of COVID exposures and illnesses among our coworkers and community partners. This is alarming and should be of great concern to everyone. Even though we recently began scheduling more in-person proceedings, I have encouraged all judges and measures to limit the number of in-person proceedings and to conduct as many hearings as possible using remote technology. Next page. The surge is also affecting our ability to transport inmates to courthouses due to isolation requirements. Another recent take in the Sarasota first appearances will be held in the courthouse. I'm sorry. What I just wanted to say is that our courthouse is making these changes. We need to make these changes in our school. Everyone needs to be masked, all staff, all children. If we have a couple people who are not wearing masks and they have COVID, they are going to still spread it to other people. Please do what's right. Things keep on changing daily. You see the cases, they are escalating. There are tons and tons of kids who are sick in our schools and their parents are not bringing them to get tested. This doesn't mean they don't have COVID. Do what's right, please. All of you, for our children. Thank you.
Thank you.
Thank you. Ashley Berridge.
Hello, can you hear?
Yes, ma'am. You have 3 minutes if you need it.
Hello?
Yes, ma'am. We can hear you. Go ahead.
Okay. For the record, my name is Ashley Barrage. I'll be very quick. I'm a parent of 2 children in Manatee County Schools, and I support a mask mandate on campuses and on buses for all students and staff. I ask that you keep a mask mandate in place until vaccines become available for young children. They have enough time to be fully vaccinated, and our local positivity rate decreases significantly. 10 days is not enough. Thank you.
Thank you.
Tan Benzio.
Ms. Benzio, please press star 6.
Hello?
Yes, go ahead. You have 3 minutes if you need it.
Okay, thank you. Hi, my name is Tyne Benzio. I do want to thank the board for the updated guidelines that were put out last week that strongly encourage mask usage and recommend that those who are eligible get vaccinated. I also want to thank you for the mask proposal. It is a good start, but I would like to suggest that you consider extending this mandate at least until the vaccine becomes available to younger children, and there has been adequate time for everyone to have access to it, particularly those in higher risk communities, and until the positivity rate has been reduced to the level recommended by the County Department of Health. Last week, there were 177 positive COVID cases reported for Manatee County Schools for the first week back. And while the majority, if not all of these, were likely to have been positive prior to returning to campus, due to the very low mask usage at many schools, there was likely a very high transmission, and we're going to see even greater numbers in the following weeks. Please follow your guidelines from last year and wait until the rate is below a certain threshold and the vaccine is available to everyone before considering rescinding the mask mandate. This isn't about me or you, it's about us and our community and keeping people safe. And thank you, Reverend Golden, very much for your strong advocacy for keeping our children safe this morning and always. Thank you.
Tara Tomlinson.
Ms. Tomlinson, please press star 6 to unmute.
Hello, I'm Tara Tomlinson. Everyone can hear me?
Yes, ma'am.
Okay. Commissioner Golden said if we mask and don't need it, no one dies. If we don't mask and we needed it, people die. This reminds me of something that I heard from the pulpit in church many times, and something that many Christians have said to me over the years in regard to being a Christian. They say, if I'm right and you die, you go to hell. If I'm wrong and you die, nothing happens. Are you willing to take that risk? Given this popular argument, I've been surprised by the lack of similar risk assessment by the good Christian parents of this community. It's the same thing. If we don't have mandated masking in schools, children and teachers could die. If we do have mandated masking in school, some children and teachers may be a little uncomfortable. The fact that anyone thinks that this is even something to consider about is just, like, frankly, deeply disturbing. You people really think that your children's minor discomfort is more important than children's lives? Then, to make matters even worse, there are parents, like this lady before me, or a few people before me, saying that, like, just literally attempting to force our children to be endangered by their unmasked children by opposing masked versus unmasked classrooms. It's like anything we try to do to protect our kids, you've got to fight us on. Why are you people so determined to endanger our children? What is wrong with you? You want all the choices and you want to give others none, when all we're trying to do is keep our kids healthy and alive. To the argument that masks are useless, cloth masks are not useless if everyone's wearing them. If this county continues to choose selfishness over community, then yes, it's very important that those of you who do care about your children and are sending them in masks, send them in KN95 so that they at least stand some chance against all the people who just don't care. Thank you to those who voted yes on this motion, especially to you, Mr. Golden, for taking a stand for our children and for what is right. Really, really appreciate everything that you've been doing and saying today. I know it's hard because you're like, you know, you guys are up against like just insanity. So thank you so much. Really appreciate you guys. That's all.
Thank you.
Aaron Vogler.
Mrs. Vogler, please press star 6 to unmute.
Good morning.
Good morning.
My name is Erin Vogler. Thank you for your time and for hosting this meeting to discuss a possible solution regarding the masks in schools. I would have preferred to address you in person this morning, but due to the increase of COVID cases within our community, the lack of social distancing, and many not taking this pandemic as seriously as they probably should, I chose to stay home. I am a parent of a second grader in the school district. My daughter's teacher is expecting a baby in early October. I find it astounding that only 3 students in the classroom are wearing masks, the teacher included. So for this reason alone, as well as for the protection of the entire class, I support a full mask mandate, like we had in place last year. I understand with the governor's executive order in place, that's not possible. So I feel at this point in time, the only option we have is a signature with the opt-out provision from parents, and that's our best alternative for the health and safety of our kids. Thank you so much for the 3 of you that voted yes to keep our kids safe. Thank you for your considerations and for serving our community.
Megan Bigel. Biegel.
Megan, if you're online, please press *6 to unmute. Megan Beigel, please press *6 to unmute. Beagle? Okay. There we go, and we'll try back there.
All right. Alex Nantes. Alex Nantes. Alex.
Hi, good morning. Can you hear me?
Yes, sir, go ahead. You have 3 minutes if you need it.
Okay, great. Thank you. Good morning, board members. My name is Alex Nantes, Nantes, and I'm a father of 2 children that are attending elementary school in Lakewood Ranch. First of all, I want to thank you, Reverend Goldman, Mr. Kennedy, and Mrs. Foreman for your positive input and your vote requiring masks to keep our children safe and our staff safe. I also want to thank you for putting some of the safety protocols back in place at our schools last week. However, while plexiglass dividers and social distancing are helpful, we all know they're not as effective as wearing a mask. The number of COVID-19 outbreaks in this first week of school was heart-wrenching. I am very disappointed that some of the board members have the audacity to roll the dice with our children's safety and ignore the guidelines of the CDC, doctors, and pediatricians across the country. This current variant spreads faster than anything we've ever dealt in the past, and we need to work together in providing our children a safe environment to learn, period. Sending kids to school without mandating masks and not having the protocols we had last year is not only irresponsible, but careless and counterintuitive. Instead of being reactive, you could have been more proactive. This is not rocket science, folks, just common sense. Our children are at danger, our community is at danger. This is a public health crisis. This is not about manipulation or taking away your rights. This is about doing the right thing. And there's no better time than doing the right thing than now. We are all tired, including myself, of this virus. We're all tired of the mask versus no mask debate. We're all tired of the vaccine debate. But I'll tell you one thing that I'm not tired of. I will never be tired of protecting our children and our community. Please, please mandate masks until this variant is controllable and children have a chance to get vaccinated. Let's make the right choice and set politics aside for the sakes of our children, staff, and our community. We have the opportunity to do what's right and provide a safe environment for everyone to learn and teach. Mandating masks, please, period. Thank you very much. Have a great day.
Thank you, sir. Karen Nantes. You can just pass the phone right over. Karen Nantes.
Hi, can you hear me?
Yes, ma'am. You have 3 minutes if you need it.
Okay, for the record, my name is Karen Nantes. I want to thank you for your time and for calling this meeting to discuss a possible solution. I also want to thank Reverend Golden for your words of support today. I am a mother to 2 sons that go to Manatee County Elementary Schools. They are both too young to get vaccinated. This is a very tough time to be a parent, and we shouldn't have to be in this place. We have a social responsibility to do the right thing. We need to accept COVID-19 as a current health risk. We need to expect and demand everyone act respectfully by masking up, social distancing, and not politicizing a public health crisis. It is our responsibility to protect our children, and frankly, we are failing them.
I work in an office where masks are required just to enter the building, vaccinated or not. I wear a mask the entire day when indoors in my office. Is it ideal? No, but I do it for the safety of myself and those around me. Not to mention, everyone I work with is over the age of 12 and can be vaccinated. I am vaccinated. I cannot imagine walking into a school setting with children that are vulnerable to catching COVID-19 and not masking up for them. Why aren't our teachers, leaders, and parents doing the same? If we can pride ourselves on putting our children's safety at the top of our priorities, why not do all you can to protect them? I really hope you can agree to pass a mask mandate, and I hope this in turn helps to encourage our leaders and our educators in the schools to mask up as well, to protect our most vulnerable population. Thank you very much.
Rebecca Masella. Rebecca.
This is Rebecca.
Okay.
Let's go ahead, ma'am. You have 3 minutes if you need it.
Hello.
We can hear you.
Okay, thank you. I am Rebecca Masella. I am a bachelor's prepared registered nurse, the mother of two, in your Manatee County Schools. I'm going to first of all apologize for any noise that you might hear, as I have a child who is quarantined from school after the very first day. Today, I know we can't go back, but we can only go forward. My problem with this is my children stayed home last year and were safeguarded from this pandemic. On the very first day in your care, he was failed. I would like to speak to a specific instance that I watched occur on the first day of school. I watched a young girl with a mask in her hand as she got out of the car rider line approach a staff member, look around, and ask if she needed it to go into the school. The staff member replied, "It's up to your mom or dad," and those parents had just drove away. She looked around, literally mumbled to herself, nobody else is, and stuffed that mask in her pocket. I was horrified. She had just made a decision that could impact her health or potentially anyone at home. Probably to her parents' dismay, and they have no idea. This mask mandate with opt-out is not the same as just currently giving people free rein as we are. I believe in a parent's right to choose. I believe in a parent's right to vaccinate. I believe for the refusal of vaccinations. I want everyone to make choices for their children that help them sleep well at night. We can all agree on that. We just have different approaches to get there. But the opt-out puts in documentation the writing, releasing teachers and board from death, disability, or any responsibility. As pillars of the community, we are requesting you to suggest compliance. I am wanting to say I am in all of you guys today. Last meeting I saw 2 or 3 of you masked. Today I see a lot more. To me, these kids are looking up to the admin and the staff around that school. It's the same as suggesting that they don't run in the hall and then watching a teacher run off. My kids are looking up to some of these teachers and wondering why I'm asking them to mask and their favorite teachers are not. Substitutes can't be easy to come by right now. Everybody's short of staff. How are dead or ill educators bridging education gaps? Unfortunately, Ms. Messenger, Broward County has just found this out by losing 4 of their own. I'd like to speak to the fact that wearing masks are not a medical intervention. This is just a simple intervention used to mitigate the spread. This is not the same as providing medication or medical care. I'm feeling very backed into a corner this year due to low compliance, and I would like to recommend that you guys do look, besides the CDC and Department of Health, at the AAP guidelines, because that's what I've relied on heavily. I have armed my children by sending them in a KN95 to school. They're not just in a mask. So I please ask you to do the mandate with the opt-out for students, but mandatory.
Santiago.
Sophia Santiago, if you're online, please press *6 to unmute.
Hi, my name is Sophia Santiago. Thank you again for your time today and for calling this meeting to discuss a possible solution. Like many others have said, I'm a parent of a first grader that's not yet eligible for a vaccine to keep her protected. And while I wish all students and staff were required to wear a mask in school and on buses, I implore you to please do all that you can to keep our children safe by supporting a mask rule with parent signature opt-out. And I do hope it's extended past the 25th based on transmission and hospitalization data. Thank you again for your time.
Thank you.
Emily Kaufman.
Emily Kaufman, if you're online, please press *6 to unmute.
Good morning.
Good morning.
Good morning. Can you hear me?
Yes, ma'am. Go ahead.
Thank you. My name is Emily Kaufman. For the record, Kaufman. I'm calling in to, first of all, thank Reverend Golden for his very kind words about protecting children, and also for Mrs. Foreman and Mr. Kennedy. Thank you for your support. I am calling because I actually have two children who I pulled from the Manatee school system due to the lack of support at the very beginning of the school year. And we have them in a different school right now with the hopes of eventually sending them back. But we aren't going to do anything until we know that children are masked, that teachers are masked, and that the mandate sits well beyond the 25th or 10 days. We need, those of us impassioned parents, which clearly you're receiving more and more phone calls and in person, you're getting so much passion here from parents who need to know that their children are going to be protected and that you hold their best interest, Ms. Saunders. So please extend that mask mandate until vaccines are available and until vaccines we know are safe for children and until parents start taking them up for their children. You need to be playing chess and look several moves ahead, which is not happening right now. Stop playing checkers. Please play chess. Look 5 to 10 moves ahead, as you should have been doing to protect our children. Thank you very much.
Thank you.
Stacy Carlin.
Stacy Carlin, if you're online, please press *6 to unmute. Stacy Carlin, press *6. Let's keep going, Rick.
Dina Sabu.
Good morning.
For the record, here again, advocating for choice. Thank you, Gina and Chad, for trying to keep and maintain that for us. Reverend Golden, it is upsetting to hear you get so emotional and start throwing the word deaths around about people dying this weekend when, you know, you can go and look at data. We know that CDC, who you are using as your experts, have published 2 out of every 100,000 children will have a death from COVID. We don't want anyone to die. None of us want anyone to die. Children die of influenza. People die of influenza every year. 11.5 children out of 100,000 per CDC data says will die from a fatal car accident. But you're not here regulating that. So I just feel like you're in a really bad position, but Gina's right. You've taken surveys. You have seen parents showing up and their children coming out without masks. We have spoken. The CDC has been consistent with their inconsistencies on wear a mask. They work, they don't work, they may work, an N95. They don't have any definitive studies on cloth masks. We have people heated on both sides. It seems like a lot of fear, and I really think that all of us are coming from the right place, but we want the right, and we are going to go about this differently to protect our children. Cynthia has sat here in this meeting all morning with the mask under her nose. If that's what everyone's advocating for to keep their children safe, that's not effective. So how do we expect the teachers to police which parent signed the opt-out, and how are they going to do that? You're not considering what this looks like for the teachers. Are they going to get a list and they're going to have to start policing Johnny, your mom said you have to have the mask on, pull it up. Oh, Michael, you don't have to wear the mask, that's okay. That takes time away from their time to do their job, which is to educate our children. So again, I'm standing here asking you to understand that you have seen the information the parents have sent their children in. This is a tough decision, but parents that aren't masking aren't going to mask. And those that believe that they need them, they're still going to do it, and it isn't going to change. And I'm sorry that you're all in that position, but please continue to honor our choice. Thank you.
Emily Connor. Emily Connor.
Ms. Connor, if you're online on the phone, please press *6 to unmute. Emily Connor, if you're online, *6 to unmute. Let's keep going, Riff.
Nicole Apostle. Nicole Apostle.
Good morning. Can you hear me?
Yes, ma'am.
Okay. I'm Nicole Apostle. I'm the mother of an elementary school student. Thank you for holding this meeting. I just wanted to express my support for a mask mandate, especially after seeing the lack of mask usage at my child's school. I'd like to remind the board that last year there was an $800,000 deficit in the budget for substitute teachers due to COVID-19, and that was with universal masks and the Alpha variant. What in the world is going to happen this year to taxpayer money with no masks and the Delta variant? Who is going to be there to keep the kids when we run out of substitutes? The fiscally conservative thing to do is to require people to take personal responsibility and mask up. Please allow children under 12 the opportunity to be vaccinated before you strip them of the right to a safe school environment. Thank you.
Thank you.
Hello.
Catherine Morningstar. Mr. Chair, that sounds like somebody that else was trying to get in.
Figure that out in a second.
Okay.
Catherine Morningstar. Whose ever voice that was a moment ago that said hello, can you identify yourself? I guess they unmuted themselves again. Catherine Morningstar, please press *6 to unmute. All right, let's keep moving, Rick.
Delilah Adrian.
Hello, good morning.
Good morning.
My name is Delilah Adrian, and I am here to go on record as a Manatee County parent who strongly opposes any mask mandate. I also am a survivor of COVID. I got COVID at the end of October in 2020. I lived in a house with 6 other individuals. 2 were senior citizens, 2 were young children, one age 8 and one age 1.5. I had to homeschool my child while I was COVID positive, close contact with that child. He was tested after after several days, enough time to be exposed to the virus. I had a pretty moderate case. Never got COVID from me. My infant never got COVID from me. My mother-in-law never got COVID from me. My father-in-law never got COVID from me. My husband, who I was intimate with, didn't get COVID from me. So the automatic assumption that everyone's going to get COVID if they come into contact with a positive case is ridiculous, and it's against the science. I'm hearing a lot of, I think, sounds like hyper-paranoid parents begging to keep kids, what I call muzzled, until a vaccine is available for children. But do they recognize that vaccines only help to prevent hospitalization in those who are at high risk of dying of COVID? 99.99% of people under the age of 49 are not at high risk of dying. COVID is going to be around for a long time. Coronaviruses have been around for a long time. This man-made virus is going to be around for a long time. It's going to be constantly mutating. When will you guys be mandating trial injections into our children in order for them to have access to fair education? A fair education involves people being able to go to school in person. Not every person can homeschool their child. There are kids with special needs that need in-person education, and if their parents and if the child is healthy and if the child does not have COVID, then they should be able to access that fair education. I don't want to take up too much of your time, but I stand before you representing many more parents who also oppose forcing our children to cover their mouth and nose in order to attend public school. I recognize that there are a lot of squeaky wheels out there, but the loudest people are not always 100% right, nor are they the true majority, I feel. From my discussions with people in the community, the surveys that go out, we want what's best for our children too. We want what's best for our community. The psychological damage caused by masking is going to come out more and more, and I feel that you will be on the wrong side of history. We will continue to support those who stand for freedom of choice, and we will continue to fight for our freedom of choice as parents, doing what we believe is best for our children, and not bowing down to the controlling behavior of people living in a constant state of fear. We are going to become more active with the board and the community leaders so our voices can be heard, and we are not going to stay silent anymore. Thank you for your time.
Thank you.
Rachel Casellas. Rachel Casellas.
Ms. Casellas, if you're on the phone, please press *6 to unmute.
Hi, this is Rachel Casella.
Go ahead, ma'am. We
Can you hear me?
Yes, ma'am. Go ahead.
Yeah, my name is Rachel Casellas. Thank you all so much for being there to hear us again. I have a first grader in Manatee County, and I really need a mask mandate in place for all students and staff. As a parent, neither the teacher nor the school is willing to give any information to me as to how many kids are masking in my son's class, how many kids are out sick, are we even encouraging masking? I get no response to these questions, yet they expect me to trust them to create a safe environment for my 6-year-old. Unfortunately, my son's teacher is quite young and refuses to wear a mask to protect my child. Please mandate masks so my child can attend in person this year. Thank you so much.
Thank you.
Aaron Cohen. Aaron Cohen.
Can you hear me?
Yes, ma'am. Go ahead.
Oh, hello?
Yeah, Ms. Cohen, we can hear you. Go ahead.
Okay, perfect. All right, my name is Dr. Erin Cohen. I'm the mother of a 5-year-old boy in a Manatee County school, but I'm also a scientist. I understand statistics. I understand probabilities. There is no question that when everyone wears a mask, everyone is safer. I support mandatory mask wearing in our schools, and this mandate must remain in place until all children have the opportunity to be vaccinated. Let's listen to science. Let's listen to common sense. Our children's lives are in your hands. Thank you.
Thank you.
Tammy Barton.
Ms. Barton, if you're online, press *6 to unmute, please. Reverend, you can go to number 26, please.
Jessica, okay, Ibasfatean. Ibasfalian? Ibasfalian?
Ibis Phelan, if you are on the phone, please press *6 to unmute. Ibis Phelan.
Jessica Ibasfalian.
*6 to unmute, please. Reverend, we'll come back.
All right. Paula Lones.
Ms. Lonis, if you're on the phone, please press *6. Ms. Lonis, *6 to unmute.
Yes.
Yep, we can hear you.
Can you hear me?
Yes, ma'am.
Wonderful. Good morning, everybody. Here we are again. A little frustrated that we're here again. As one of the callers said, there's a lot of impassioned parents on the phone today. But we've had impassioned parents coming here for months and months talking about all of this. And part of the reason we're so passionate about it is we are following the science. And over the past year, we have learned a great deal that the masks aren't doing anything. It's more of a blanket to make you feel a little bit better that you're doing something for the greater good. When in actuality, it's not doing anything. You've had teachers come up here and say that they've had children in their classroom, these 2-year-olds, you know, they swap masks, they drop on the floor, you know, they have dirty hands, they've got food stuck to them. They just don't work. Reverend Golden actually said earlier that kids don't have any protections against COVID. Kids have a lot of protection against COVID. They have strong immune systems, and that's why they're not impacted the same way that adults are. You know, I looked at your chart or the decree you had on August 12th that said 76 people were infected. Now I'm hearing 176. Regardless, when you spread 76 or 176 over 50 plus schools, that's only 2 or 3 cases per school. And it's really a 0.05% of our student population. I mean, we've had schools that had 76 to 100 students out for the flu in the past, and everybody still kept going. So I think that we have to really take a step back and realize and remember that we're talking about 50,000 students. And it's a very minute percentage that this is happening to. They don't have the same effects as adults do. So I don't care about the 12th Circuit Court that's shutting things down. They are adults that are working there. We're talking about kids, and it just doesn't affect them the same way. We've also learned over the past year to not necessarily agree with what comes out with the CDC, because a lot of independent physicians and labs and groups from around the world and around the country have shown that a lot of these numbers are skewed. The testing is skewed. The quote-unquote positivity rates is just on a percentage of those tested, not of those in the community. And I mentioned that the last time. Dr. Bensi kept saying that our positivity rate is 16%, but that's only on 12,000 people that were tested. We have 405,000 people in our population. So these numbers and this fear mongering is ridiculous. So I think, part of the reason that, you're getting in here to push this agenda, and I know it's a game of inches for you guys, 1 inch, clawing away, chipping away at our freedoms, but it just doesn't make any sense. The parents have spoken. They're not sending their children to school with masks. If people are that frightened, let them stay home.
Thank you very much.
Or let them wear a mask.
Mary Bear. Mary Bear.
Mrs. Bayer, if you're online, please press star 6 to unmute. B-A-E-H.
Good morning.
Yep, good morning. We can hear you.
Thank you. My name is Mary Bear. I have 3 children in the Manatee County Schools, 1 in elementary and 2 in middle school. Thank you for allowing me the time to speak today. I wanted to voice my support for a universal mask mandate in the schools. The current optional mask policy does not place the choice in the hands of the experts or even the parents. It leaves it in the hands of the students, and that's unacceptable. Ideally, it would be a universal mandate that follows the CDC guidelines. We should be following the experts in the field, the experts. The decision to remove or alter the mandate should be based on statistics and numbers, and again, experts. Based on the percent positivity in the community. When the board removed the mask mandate in the spring, the percent positivity was extremely low, below 5%, I believe, if I recall correctly. Based on the capacity of our ICUs at local hospitals, we're currently at a 93% usage. All children's ICU is at 100%, and my friend's child is being transferred to Tampa, where they were able to find a pediatric ICU bed for this child as we speak. Our ICU beds are running out, and our community's ability to get critical care is in jeopardy at this point. You all know in our first 4 days of school last week, we've gotten more COVID cases than we did in any 1 week all last year. Willis Elementary School needed 9 substitute teachers today because of positives, exposures, and quarantines. How many subs has the board budgeted for in this school year? We fiscally cannot afford to ignore the most beneficial virus mitigation strategy available to all of our student body, mask wearing. Make it mandatory for all is the safest option for all. Giving misinformed parents the option to opt out is giving those children the right to infect students and staff and their families. The preschool our son used to go to was where no one wore masks, just had COVID spread throughout it very quickly. Many point out that the children were mostly okay, but a staff person's husband died at only the age of less than 40, and a mother of 6 that volunteered at the church is on a ventilator, from the last I heard. And there were several other hospitalizations amongst the staff and parents. I appreciate all your hard work, and I know it's hard to listen to so many voices in this important issue, but I think listening to the experts is the most important voice to listen to. Thank you for my time today.
Thank you.
Allison Hanson.
Ms. Hanson, please press star 6 to unmute.
I'm here.
Yes, we can hear you. Go ahead.
Can you hear me?
Yes, ma'am. Go ahead. You have 3 minutes if you need it.
Okay. It's hard for me to believe that we had 2 weeks to flatten the curve and now it's 18 months later. I just want to ask the question, could it be that what we've done in the past has not been helpful? Nearly the whole world masked up and social distance, and many parts of the world in our country locked down. And then a fast-tracked experimental jab was injected into millions of people and was supposed to save the world. But that has led us to an outbreak of a respiratory virus during the summer, a time that respiratory viruses do not usually cause an issue.
So what's going on? You have to ask yourself the question, what got us to this place? Was it the small percentage of people that didn't comply, even though the incredible majority of people did comply with mandates and such? Or could we consider for just a moment that it is those very mandates and guidelines from the CDC and our boards of health that have not only not done what they claim to be able to do, which is stop a virus, stop spread, or stop infection, but they've now most likely caused or driven an outbreak of a respiratory virus in the middle of the summer. So I challenge this school board to do something different. Don't just continue to repeat the failed policies of the last year and a half. Look at all the consequences of masks and distancing, please. I had to take 2 of my 4 children out of Manatee County Schools last year to homeschool them indefinitely because of the negative effects that masks and other regulations were having on them all across the board. So what are some of the results that happen in kids? You say they can stop the spread with masks, but here we are with the virus still spreading everywhere, and data shows that depression, loneliness, suicidal ideation, and actual suicides have gone up in kids. Kids started getting headaches, more colds, sores on their faces, ears, mouths, increased acne, strained connection with teachers and classmates, increased breathing and focusing issues. Those are all possible consequences of masking and other regulations. I don't think that every child or every adult suffers from those things, but many do. So it needs to remain a choice. I have shed tears with teachers about how just the masking alone negatively affected their classes and their students all last year. I've tried to give comfort and encouragement to other teachers, even just last night, amidst their fears that these restrictive policies will be forced upon them and their students again. And so I challenge you, board, to consider these things. Consider the epic failure of the governmental regulations, quote unquote, health guidelines, to do what they've promised to deliver. Consider honoring the right of a parent to choose what is best for the whole child outcome of their own children, whether that is to send them to school as they always have or to send them masked. Consider honoring the bodily autonomy of your employees to choose what they deem to be safest for themselves, be it masks or no masks. This is an issue about who has the right to make medical decisions for one's body, the individual or a parent or a panel of people who supposedly know better. I hope you still have that spark of liberty within you. And
Thank you very much. Heather and Paul is the names that I have listed. Heather and Paul. Heather and Paul.
Miss Paul or Mr. Paul, if you are on the phone, please press *6 to unmute. Let's keep going.
Okay. That looked like 2 names. Heather. Yeah. So. Okay. Catherine Burns.
Ms. Burns, please press *6 to unmute.
Good morning.
Good morning.
Good morning.
Good morning. We can hear you.
Everybody. Thank you.
Thank you.
First, I would like to, this is Katie Burns. I would just wanted to thank Mrs. Messenger and Mr. Choate for their rebuttal on both on the 2-minute decrease in our time and also for recognizing the Parental Bill of Rights, which was passed this year. And as a side note to Mr. Golden, that has actually been in the works for 10 years. I know that it wasn't signed into law until this year. We are now on day 518 of Slow the Spread. When does it stop? You say now that you're talking about putting in this mask mandate until 8/25. How can anyone believe that it would stop there if we're now on day 518 of Slow the Spread? It's our right as parents and as individuals to make our own choices. No opt-out should be required. I know that we've already discussed this multiple times. Why can't the employees also make their own choice? I know that we're talking about adding that in there, but they should be able to make their own choices as well as parents. The mask mandate was not embraced. Sorry. Golden, please show me where you have the right not to be infected by someone else. That's not listed anywhere in the Constitution. You have the right to take precautions for yourself. You haven't done the same thing with flu. I would lay money on it. And if you're not going to, then this shouldn't be any different. It's a dangerous freedom. I picked this over peaceful slavery. 0 children have actually died in Manatee County. Only 9 children have actually died in the entire state from COVID-19. Trying to push this mandate, expecting people not to know better, Just as Misty did last year, saying that they couldn't enforce the mandate, it's the same thing. That's sneaky and it's wrong. The CDC doesn't make any laws for our states. They're sovereign, and we have more power to govern as we choose. And Mr. Kennedy, if you do not know the demographics or politics of Manatee County, perhaps you aren't serving in the appropriate position. This isn't about groupthink. That's un-American. America was founded on individual liberties. Please continue to let parents choose and employees choose with no opt-out. Furthermore, we have previously sent many studies and publications. Personally, I've already sent over 100 to you guys to review throughout this year. Many came from the International Journal of Environmental Research and Public Health. They show that masks are not effective and they cause many issues, both physical and mental, especially for children. So again, I beg and please remove the mask mandate. Do not require opting out for this. Thank you.
Thank you.
Amy Hammond. Amy Hammond.
Ms. Hammond, if you're online, press star 6 to unmute, please. Ms. Hammond, star 6. Amy Hammond. I can hear something. Ms. Hammond? Let's keep going, Rev.
Glenn Gibellina.
Glenn is here. Mr. Gibellina, it's going to take a second to get it up. So just letting you know.
Good morning. Glenn Gibellina for the record. Chad, thank you for sticking around the extra 3 minutes. Means a lot. I appreciate that. But I do want to emphasize that, you were given some misinformation on how many signed up for the public comment. And I will tell you, by 8:59, before he drops that gavel, we have to electronically sign up. So he knows exactly how many people are here, just so you know. So I'm a numbers guy too. So if we looked at, is it up yet? No? Okay. But I see my time is running. So you're going to have to stop the time because this is important.
Tell you what, Glenn, could we just go to the next speaker while we're taking,
Yeah,
because we got to
that's
scan that. And Ms. And
Andrew.
Glenn, stay close. We'll come to you next.
Andrew Griffin.
Andrew Griffin, Manatee County activist. So we're here again over these masks. I really don't care how you put it because the bottom line is the opt-out is the kids not coming to school with a mask. The attorney said that. They don't even have to fill out a piece of paper. I mean, we're just playing on words to make people feel good, right? I mean, that's really what we're doing. We've got a Republican here voting with the 2 Democrats on the board, all on the name of word game. This is only a word play game. So you guys want to make sure all the parents that want to mask their kids feel great and all warm and fuzzy. But it's really the same thing, right?
Just 1 second. Ms. Rhodes, you were not here before when I issued a warning, so this is your warning. If there's any more outbursts, you will be asked to leave. Ms. Griffin, I'm sorry, go ahead.
So, I mean, that's really what it is. So so parents don't have to send their kids with a mask on. They don't even have to fill out a paper. But kudos to everybody up here for wasting everybody's time all frickin' morning. How many hours are we going on? We were here at 9. We're not going to be out of here until like 1 o'clock, 12 o'clock. Kudos. Kudos for a big waste of time. Who did this help? I guarantee you after 18 months of this, the parents that are going to send their kids without masks, guess what? They're going to still send their kids to school without a mask. You did absolutely nothing. Nothing. She knew that. You knew that. You knew that. You knew that. And you knew that. So what are we doing here? You guys can't answer that because this is my public comment, so I'm going to sit here and tell you how stupid this was and how much of a donkey 3 of you guys are. With that, I yield the rest of my... Look at that. I got that in under 1 minute. You guys are a bunch of donkeys.
Mr. Gibellina.
I'm not sure if that's name calling or a compliment, but please, our bylaws on public comment ask that you not engage in any personal... Okay, thanks. Bye.
Downsize that So I'm a numbers guy. Glenn Giblina will try this again. I'm a numbers guy. So, I all sent you an EPA with the research, what they did on the masks. So my first question would be, all the Manatee masks that you had made, did you bother sending that to the EPA researchers to see what the filtration was? Can anybody answer that question? Probably not. So the filtration study found that the effectiveness of masks varied widely from three-layer knitted cotton masks that blocked the 26.5% of the particles. If you got a 26% on your test score, that'd be an F. So 74% can get reinfected by 99% of the masks that you give the kids and teachers. So I believe it is very, very ineffective. And really, the only effective mask that I have found out there is the N95. And you guys, if you're going to do it to the bus drivers, whoever, then you should provide that like the county. Dr. Hopes was on his public comment. Anybody walks in the building gets an N95 mask because they are effective. That garbage you're working there, that don't work it. In fact, they tell you if you twist your ear things, it'll be more effective because it closes up your mask more. But nobody speaks about that. And as far as putting in your personal opinion into how you feel, how you personally have to be protected, it's not your job. Your elected official is to represent your constituents, not how you personally feel or how you need to be personally protected. If that were the case, everybody should have a concealed weapons carry to protect me. I mean, that's how I look at it, but you don't. So all I am saying is the masks that you're wearing, they're not tested. I would like to know that percentage, how effective they are. But you can't give me those numbers. And the health department, because they call it an emergency, doesn't override the governor. And, the phone calls, they were funny. They're almost like they were coached calling in here. I don't know how you guys do the call in, but that was pretty fun. And the 50,000 students, 117.0003% of the students. I'd like you guys to go back a couple of years, 2019, and see how many students called in with a common cold. I guarantee you it was more than 117. So I don't buy the mask. I believe the depression and everything else that goes with that are valid points, not to mention our constitutional right. And I'm a numbers guy. Send the mask to the EPA. Let me know what they are. You're going to be surprised and disappointed.
Martin Hyde.
Well, good morning. My name is Martin Hyde. For the record, I am running for Congress to represent all of Manatee County.
Mr. Hyde, you can't come before us and...
It's not an electoral state. It's a simple statement of fact. If you don't like it, we can just reverse time. Okay. The calling of this meeting from last Friday was such unseemly... I beg your pardon?
No.
I don't think that the chair
No, Mr. Hyde,
has
continue.
made a ruling
No,
with
he's fine.
respect
Go
to the
ahead. You can
objection.
continue. Go ahead.
Okay. Well, I'd heard about this place. I've seen it for myself now. Let's reverse that time back, though. The calling of this meeting from last Friday with such unseemly haste at a time when most parents are likely to be taking their kids to school or to be at work, apart from the socialists, is not, in my opinion, coincidental. The reason for the national mad mums and mad dads movement is this continual, blatant politicization of our school system. The political grandstanding has no place on a local school board. This is about parental rights and freedom, not your virtue signaling to the local leftist media. Every parent has the right to have their kids wear a mask if they so wish. Parents who have kids over 12 have the right to have their kids vaccinated. However, just like my right to the First Amendment stops at your nose, so does your authority to stop short of mandating cloth masks on the face of our kids for 7 hours a day. You can ask nicely. You can express your point of view. But what you cannot do is impose medical decisions on minors without parental consent. This is not only my opinion, but clearly that of the governor of our state. He has said clearly that any school board who defies his order, and let's be clear, it's an order, not a nice suggestion, is subject to sanction in terms of funding. You swore an oath to uphold the Constitution of Florida, which requires you to obey our duly elected governor. Everyone knows that no one should ever come between a husband and wife if they're arguing, and everybody knows, apparently apart from the board chair who called this meeting, that you never, ever poke your nose into the parenting of someone else's kid. This is America, not North Korea. Before you vote, ask yourself some questions. Does this governor really look like he's about to be pushed around by you? Do you really think that the Biden administration, with its myriad of other problems here and around the world, will be there to bail you out when the state cash dries up? Be under no illusion. If you go down this path, there'll be winners and there'll be losers. Which of you thinks you'll come out ahead in a standoff with America's most popular governor and against the rights of local parents? In a way, I almost hope you're daft enough to try, as then he can appoint a whole new school board when he removes you for cause.
Thank you.
Jamie Marco.
Miss or Mr. Marco, if you're online, please press *6 to unmute.
Good morning.
Yep, go ahead.
Good morning. Can you hear me now?
Yes, go ahead. We can hear you.
Wonderful. Thank you. My name is Jamie Marco, and I am the parent of a child in elementary school here in Manatee County. First of all, I want to thank you all for your time today, but I also just want to state a few things. There's no reason for me to give you statistics or numbers. You've heard that all this morning. What we need to focus on is the definition of insanity. Doing the same thing over and over again and expecting a different result. Our children are our future. My daughter is home this week because of exposure at school and woke up this morning with a fever. I am terrified. I am scared. I've been sending her to a mask to school every single day. 3 of the children in her kindergarten class are sick, and 1 of the children is not doing well. She is 5 years old. You have it in your hands to make a difference and make a change. If everybody wants the choice for their child, then the opt-out is the way to go. Opt out that your child doesn't have to wear a mask, and you take that risk. But don't make the rest of us risk the future of our children. You are elected officials, some of you appointed, and I'm looking at you. You may not see me, but please look up right now. Look up and look at me and tell me that you will take it in your hands when the children of our community continue to get sick and die and the long-term effects. You have the choice to make a difference. You have the choice to do what we elected you to do. Please do that and put this mask mandate in place with the opt-out. Choose the children. Choose our future of our community. Thank you.
Thank you.
Megan Wilcox.
Ms. Wilcox, if you're online, please press.
Can you hear me?
Yep, go ahead.
Hi, hello.
Yep, we can hear you. Go ahead.
Hi. Good morning, board. Thank you for having me. My name is Megan Wilcox, and I have a 4th grader at Willis Elementary. I want to start by saying thank you to the shockingly small amount of board members speaking in the best interest of my child and everyone else's child safety today. The board members hiding behind the notion that they're fighting for a parent's right to choose as a means to push their political bias is just, it's utterly appalling. My child's right to live and thrive healthily does not get to be flushed down the toilet because of your unscientific opinion and ridiculous pursuit of defending some non-existent attack on liberty and rights. You have no problem enforcing a school dress code as ridiculous as my son having an Old Navy logo on his jacket, but this is something we draw the line on for parental choice, children's safety. Make it make sense, guys. Secondly, the severity of the situation is increasing astronomically by the day. We are only 1 week into school and 9 teachers, 9, are out at Willis Elementary today. My son's 4th grade class had a positive case last week, and I had to find out through another parent, not the school, that it was my son's class. Your policies are preventing families from knowing about positive cases in their children's classes and instead deciding for us if you think our kids were exposed or not. I highly encourage this part of the protocols to be revised, as it is impossible to effectively track a class of 20-plus kids confined in a small room. I'm sorry, I'm sick to death of hearing from families who have had COVID in their households, and because they turned out okay, they think it's okay for my family to contract it. I'm the one who has to wipe my child's tears away when he cries in fear of exposing his immunocompromised Nana or baby sisters. The lack of compassion for my family and others' families, going so far as to call it a mask of muzzle, speaks volumes of these people's ability to speak and think rationally. As little as you care for my family, I care deeply for all of yours and follow the advice of scientists. These families tell me and my child to stay home, but we can't. There is no e-learning option nor anything in place that accommodates a child like mine that receives in-person services without completely having to remove him from the school system. Stop giving these conspiracy-driven, freedom-fighting crazies the power to fail our kids. This is not some violation of American rights or infringement on freedom. This is a public health issue. Last, I begged the Superintendent Saunders to initiate a mask mandate of any kind at this rate, anything at all. You all have a responsibility to protect my child, to protect your staff, and as I have directly in my own career wholeheartedly protect some of your children, please, please do the same thing for me and everyone else. Thank you.
Thank you.
Janet Davis.
Good morning. My name is Janet Koppel Davis, and I look around the room, and I'm probably one of the seniors here. I'm going to be 76 in a couple of months. And I remember as a child getting vaccinated in the public school against polio. I also remember sitting under a desk for fear of bombs landing. So anyway, with that being said, I'm the mother of 3 grown children. I have 9 living grandchildren. I'm a former educator with a couple of degrees, and I'm a present-day mentor at Samoset and at Oniko when I could get there. Met my husband 53 years ago. We committed to each other, and when we committed to having children in our family, we committed to making the best efforts in teaching and raising up to be the best people they could be. Our methodology is simple: educate them through word and example, to give them the spiritual values of love, joy, peace, patience, kindness, generosity, gentleness, faithfulness, and self-control. To teach them the basics of living in their first community, the family, then through exposing them to life in the community of the church, and further in the community of the neighborhood, and then, yay, the public schools, hooray, which is a wonderful thing. I'm a product of the public schools, as is my husband with a PhD. To what end was all this teaching on our part, and furthermore, the part of the public schools? Was it so that our kids could spout facts, figures, dates of historical importance, and the like? No, indeed. I submit to you that it was so that they could learn to be thinkers, synthesizers, and discerners of truth versus fiction, and how to live in community on the local scene and out in the world wherever they may land. Living in community meant to us that we and our kids would always think of others in light of what was the best way to maneuver through life for the common weal, meaning in modern terms, the welfare of all. Not just for us, but for all. This still means the same: caring for our neighbors, enough to make ourselves and our children uncomfortable for a time, so that the safety and well-being of all in the long run can be assured. We must know that one's personal liberty does not extend into the space occupied by others, when that liberty can and does impact the safety and health of those others. If we as parents and educators don't have this kind of grounding in our mindset and why and how we are educating our kids, we can never expect them to become the citizens of the world and can think and discern in ways that really matter. And today we are faced with a problem that impacts every person on the planet. We know what it is, and hopefully we know how to face that problem head on. Please vote yes for the mask mandate with the option level, so we don't have to close our schools.
Thank you so very much. Amen. Okay. Dustin Vigneault.
Vigneault.
Go ahead, sir. We can hear you.
My name is Dustin Vigneault. I'm 41 years old, and I'm an immune-compromised veteran that's in the community. I understand parents in our community are concerned for their children. They want to have the right to choose whether or not their child is masked. but that individual liberty requires personal responsibility on behalf of the parent. On a good day prior to COVID, parents regularly sent their children to school sick. That is no different now in the middle of the pandemic. My daughter attends Stewart Elementary. She's in the 4th grade. The parents of one of her classmates sent their child to school sick on day 1 without a mask. The child was pulled out of class on Wednesday, day 2 of school, without a mask. The principal came into the class with the children there and measured out the exposure radius with a tape measure. On Thursday, day 3 of class, the exposed children were removed after lunch. Out of 24 children, 9 remained. This isn't political. This isn't a business decision. This is a public health crisis. Mask until the vax, please, for my daughter, for your staff, and for our community, people like me in our community. Thank you very much for your time. I hope you guys make the right decision.
Thank you.
Have a nice day.
Don Kitterman.
Ms. Kitterman, if you're on the phone, please press *6 to unmute.
Hello.
Yes, we can hear you. Go ahead.
Good morning. My name is Dawn Kitterman. Thank you for the time. I wanted to take a moment to address some concerns that were expressed in this discussion about manipulation and whether or not parents would be manipulated by having a mask mandate with opt-out. And I wanted to touch on another aspect of manipulation and who is manipulating who. I am right now on the Florida Department of Health website, and I am looking at a link which is floridahealthcovid19.gov prevention. And when you scroll down this page, as it lists prevention measures to fight COVID-19, one of the listed points is to cover coughs and sneezes. It goes on to say that this is important because COVID-19 spreads when an infected person breathes out droplets, and very small particles that contain the virus can be spread to others. While it does not mention using masks, while others are arguing that masks simply just do not work, then why are we covering our mouths? Why are we even recommending that? Also, on the Florida Department of Health.gov/schools, there is more guidance provided by Florida Department of Health, and the very first link on this form directs the reader to the CDC guidance for operating child care programs during COVID-19. Why is our state health department directing guidance to CDC for preschools? Preschools can't be controlled by the state, such as our public district schools. And if you click that link, it takes you to a form on the CDC that says everyone over the age of 2 should be masked regardless of vaccination status. That is being recommended through the Florida Department of Health. They are directly contradicting what they are telling us is okay to do in our schools. If you scroll down this page, there's a list where it says Florida Child Care Program directions, and again, it directs you to the CDC. There is another page on the Florida Department of Health website that is infection prevention and control resources for correctional detention facilities. Would you believe that when you scroll this page, it directs that everyone should be masked? In fact, it speaks of PPE and links directly to CDC guidance. Why are they doing that? If it's safe for our children to all be together, why on earth are they directing these other agencies to refer to the CDC? So, Mrs. Messenger, I really would like you to heavily consider who is manipulating who here. Reverend Golden, I appreciate your strong stance, and I understand the all the aspects of not wanting to legally challenge. But we are to a point where we have got to do the right thing. Hospitals are filled. There is a lot of discussion.
Thank you very much.
Thank you.
Amanda Ballard.
Good morning.
Good morning.
My name is Amanda Ballard. I am an attorney. I'm also the mom of a child who's in VPK in Manatee County. And I think that probably one of the saddest effects of government overreach and the heavy-handed media response to COVID-19 is that it's robbed a lot of formerly rational people of the ability to make proper risk assessments for themselves and their families. There have been about 350 children who have died from COVID-19 in the United States. In Florida, that number is 9. The CDC estimates that that the number of pediatric deaths from the flu in 2017, 2018 was 600. Yet prior to COVID, if you'd had someone who said that a rational response to those 600 pediatric deaths was to make all the children in schools cover their mouths with a spit-soaked rag for 8 hours a day, you'd be laughed out of any school board in the country. We need to have a rational response that's tailored to mitigate the problem. My daughter is a very young child. She has a speech impediment. She's learning phonics. She's going to be learning to read. So I would suggest not only that we don't mandate masks with the opt-out, but also that we actually, I'd suggest a different mandate. I'd suggest that we actually mandate that teachers who are teaching phonics, who are teaching reading, who are teaching speech, and who are teaching children with special needs, that those teachers be mandated not to wear masks so that our children can actually learn properly. We're seeing research now that's showing that kids who were born during the pandemic have measurably lower IQ scores. We're already seeing those effects. We've seen child deaths of despair. We're seeing all kinds of psychological effects, and mask mandates for these children are absolutely not the way. We all know that this is not to protect children. The children are not at risk. This is to protect adults and to make adults feel more comfortable. Adults have had the ability to get the vaccine if they want it. At this point, this should be a parental choice. If parents are scared, their children can stay home, or they can choose to get an N95 mask for those children. Thank you very much.
Hance Ellington. Hance Ellington.
Hance Ellington, if you're online, please press *6 to unmute.
Hello, this is Hans Ellington. I just want to call in real quick. Thank you for the opportunity. I fully support mask mandate with a written opt-out or any further measures we need to take to protect our children in the school. I think these mask mandates, the mask mandates should be in place at least till children can be vaccinated or till community spread is extremely low per CDC guidelines. Thank you for your time, and I hope you vote with the safety of our children in your mind. All right, thank you.
Thank you. Nicole, I just have a first name here, Mr. Chair. Nicole.
Nicole, if you're waiting online, please press *6 to unmute. Okay, let's keep going.
All right. Betty Sales Rhodes.
Oh, thank you. I'll come back to him. Thank you.
Good morning. My name is Betty Sales Rhodes. We as people should stop letting politics play a role in here. I am for mask mandate. And plus, another thing, you should go by what the health professionals say. Now, one thing I need to say is this right here is we have some board members do not want masks, some want it. I need it. We got to think about our special needed kids here. Special needed kids need kids around them to have those masks on. And another thing, here in Manatee County, we want to have all this going on. Parents know when their kids are sick. Why are you going to send them to school? You know the rules, but they don't tell you what to look for COVID-19. And teachers know the same thing. Now listen, I'm not biased or anything, but I know a bus driver that drives. And where he take the kids at, and nobody on his bus, but guess what? There was 4 kids on that bus, and he had COVID. He got to stay home. I don't know if y'all paying him or anything, but if you can get my drift, you know the kids who was on that bus. And he have COVID. He got to stay home for 14 days. And that should never happen. What we doing wrong is we let our guards down like you all used to do. When the kids come into the campus, somebody be, I know at Paramount High, somebody be at that gate checking your temperature. And that's what they should do. Everybody know. I go for masks. You can hear this. And another thing, y'all let the governor threaten you all in the commission of education. Do you know he have 6 kids, but he with U.S. charter schools, so his kid's not going to go to a public school. He only have 1 kid going to a public university, and that's up there where they at. His kids go to charter, so you know charter schools, when you go into a charter school, you're going to have to go just like up front, stand in front, and take your temp. So he can say, and the governor of Florida, his kids are small. So, hey, he ain't got to worry his kids home. You don't let them play politics when you know something is going wrong in here. And I apologize, Reverend Golden, for wanting, Charlie, y'all need them masks and everything. We can say whatever we want. Those kids need to have masks on. They really do, until this really settles down. They haven't settled down yet. It's out there. If you go by the Civic Center, you go there by the bus station, the line is all the way around. Parents want it. You got to protect our kids. And I have a special needs niece, and y'all gonna have to protect her in that school. She haven't went back yet till y'all get this mask mandated right. Thank you.
Thank you. Tracy Pratt.
Good morning, school board, superintendent, council. My name is Tracy Pratt. I am the chair of the Manatee County Democratic Party, and I am here to read into the record a statement that we have put forward towards the school board. It can be found on our website, www.manateecountydemocrats.com, if anyone would like to read it in the future. The Manatee County Democratic Party supports scientifically validated efforts to mitigate the spread of COVID-19 and protect our children, teachers, and school staff to the best of our community's ability. The United States Centers for Disease Control and the Florida Department of Health recognize the proven effectiveness of masks and social distancing in mitigating the spread of this dangerous disease. We encourage the Manatee County School Board to follow the guidance of these nonpartisan scientific bodies. Therefore, we encourage a return to the same protocols as last year in order to provide our children and our community the same level of protection. We need these protocols now more than ever as the Delta variant is ravaging our Florida communities and overwhelming our hospitals with record levels of admissions. We also call out Governor Ron DeSantis' order forbidding mask mandates in our schools as big government overreach. Decisions protecting the students and staff of our county schools should belong to our county. The Democratic Party supports local rule. We are disappointed the Republican Party is unable to see the wisdom of this position, which they have historically claimed to embrace. As always, the Democrats are avid supporters of strong public schools because that is what is best for our community. To ensure strong public schools, we need to trust in our local elected officials to determine what is best for our communities. As such, we encourage this board to make the decision that is best for our students, teachers, and school staff. We encourage you to seek and utilize the advice of scientific and public health experts, and those experts recommend masks. I would also like to point out that I am married to a public health physician who puts COVID reports together for providers across the state on a weekly basis. And I heard a lot of misinformation today about masks. The overwhelming scientific majority recommends masks to reduce the mitigation of transmission. That is just a scientific fact. And I think if people have questions about that, they should reach out to their own healthcare provider and get the proper answers that they need. Thank you very much.
Reverend Golden, we had a few folks that were not on when we called. If you don't mind, could we run through those names? 1, 2, 3, 4, 5, 6, 7. We got 7.
You want me to start back at the top?
No, I've got them noted.
Kathleen Flora?
Correct, yeah. Ms. Flora, if you're online, please press *6 to unmute. Ms. Flora, *6.
Next one I have is Megan Beagle.
Yes, sir, me too. Megan Beagle, *6 to unmute if you're still there.
And I have Stacy Carlin.
Stacy Carlin, *6 to unmute, please. Ms. Carlin, *6.
Then I have Emily Connor.
Emily Connor, *6 to unmute.
Then I have Catherine Morningstar.
Catherine Morningstar, please press *6 if you're online.
And then I have Tammy Barton.
Ms. Barton, please press *6 if you're online. Ms. Barton, *6.
Can you hear me?
Yes, go ahead. Yep.
Hello?
We got you. Go ahead. Good
Okay,
morning.
yes. Tammy Barton. I wanted to let you guys know experience that maybe you haven't gone out to find schools, mainly private schools, who have not followed mask mandates throughout the entire pandemic. My son goes to one of those schools and has not missed a day of school. He goes to care in the summer because I am a single parent. And they, I believe, had 5 cases the entire pandemic. Not one of them caught at school, not one of them spread at school. Not one from a teacher to a child, not one from a child to a child, and vice versa. So I understand the fear from the parents, but the reality is that it is not spreading in the schools. There was no mask mandates, no social distancing, none of those protocols other than maybe some hand sanitizer. So I keep hearing Reverend Golden say there's no protection for our kids. And with you being a reverend, that's really concerning because God did give us an amazing immune system. There's plenty of treatments. There's prophylactic treatments. My son has not been sick one day. I'm actually immune compromised. I have not been sick one day. We don't wear masks. We haven't stopped going and doing the things that we do with our life. Gina, I wanted to thank you so much for pointing out that this is true manipulation. The motion doesn't change anything other than requiring a paper trail for those who choose not to wear a mask, and that is just wrong. So I want you to think about these things, and also I believe that it opens us up for risk of lawsuit because of the governor's mandate. Thank you.
Okay. Jessica Ebispalian.
Mr. Choate, can we get help on that?
Ebispalian?
Ebispalian, yeah, Ebispalian. Ebispalian, okay. My interpreter says Ebispalian.
Ms. Ebispalian, if you're online, please press *6.
Okay. All right. Next, I have Heather and Paul.
Heather and or Paul, if you are online, please press *6 to unmute.
Then I have Amy Hammond.
Ms. Hammond, please press *6 to unmute.
And then the last name that I have is Nicole. It's a first name. I don't have any other names. Those are the names that I had, Mr. Chair.
Okay, I think that's going to conclude public comment then. I do have 2 of you lit up to speak. I certainly have a few things I'd like to address from public comment that are blatantly false, and I think the record needs to be corrected. But I'll start with you, Reverend Golden, and then Mr. Choate.
You know, I'm going to do something that I rarely do. I'm going to withdraw.
Okay, Mr. Choate. Both you guys lined up to speak. I don't.
Yeah.
Oh, okay.
Can we just from some of the comments there, one for Superintendent Saunders, can you give, for the record, what's our procedure if someone does get COVID in a classroom? How are parents notified? Is my first one. My second thing is, I think someone said there's no e-learning. Is there still Manatee virtual platform out there for folks to be able to use that as education?
Absolutely. All of our contact tracing and addressing positive cases in our schools are being conducted by the Department of Health. So we have 2 full-time staff that are placed here in this building, and they are working with the nurses in our schools for conducting that, and they are following the guidelines set by the Department of Health. So once a school has a positive case, those individuals are addressed directly. If anyone has, per their guidelines, been in close contact, they are directly contacted. Others would not be contacted other than an alert of possibly a case in their class. Because of HIPAA conditions and regulations, we are not able to divulge names or more information than that. But again, that is being conducted and worked with the Department of Health. Our e-learning platform that we used last year was a virtual platform that traditionally we do not receive funding. It's not one of the approved funding mechanism per the statutory guidelines. Therefore, because we are not in an executive order where those provisions are allowed, no district is allowed to continue with that this year. We do, however, have a virtual platform called Manatee Virtual. It is a subset license with Florida Virtual School. So all the license, the standards, et cetera, in that platform is ran technically by them. But it is in place by our teachers. We hire our teachers based on the number of students that sign up, and it is conducted in that way. So it's a little bit different. It's not tied directly to the school. It is with the district. And if students enroll in that platform, they are able to and have to remain in that platform for the semester if they're going to receive credit or grades. They can transition back after the semester. We do have that platform still open for enrollment. It's elementary through 12th grade. We have it open through the remainder of this week. After this week, it will be closed because there will not be enough time to award grades or credit. Parents also have the ability to enroll in homeschool if they want a different platform or different options. So there definitely are options for parents.
And someone mentioned quarantining and with masks, and correct me if I'm wrong, but regardless of whether you're wearing a mask or not, the contact tracing is what it is. And you would go into quarantine whether you have a mask on or not.
That is correct.
Okay.
Whether we have the shields in place or the mask in place, if you meet the proximity of 6 feet or less in close contact with a positive case, you still have to remain in quarantine. And then there are different protocols in place this year than last year. If you are vaccinated, you do not have to be quarantined. If you've had COVID in the last 90 days, you do not have to be quarantined. But the mask does not prevent the quarantine of exposure.
Okay. And just lastly, I know the answer to this. Has anyone in the district, leadership-wise, ever said to anyone that you cannot wear a mask to school?
No.
Okay.
As a matter of fact, it's encouraged for all parents or individuals that prefer or want to choose to wear a mask to wear one.
I'm good. Thanks, Charlie.
Okay, you bet. Okay, anybody else?
I have some questions.
Ms. Foreman, go ahead.
We are members of the Central Florida Public School Boards Coalition. Reverend Golden, I believe you're our representative on that. Have they done anything? Are they?
Oh my goodness gracious. I never thought this would happen. Bishop, yes, Mrs. I am in the middle of a school board meeting, and I was just asked a question. Can I call the bishop right back, please? Yes, I do. Thank you. All right. That's fine. That's fine. Thank you. I want to apologize to everybody for having to take that personal phone call, but as has been pointed out by many people many times, I am a minister. I'm an African Methodist Episcopal Church minister, and that was my bishop calling. And I had to take that call. Didn't even have time to go out the room. I'm sorry, Ms. Foreman. Go ahead.
Yeah, I was asking if the Central Florida Public School Boards Coalition has taken any action or any position on
I don't know whether or not the Central Florida Coalition has taken any action, but I did speak with Mrs. Messina from the Florida School Boards Association, and there has been no action taken by them formally. They are getting information from the school boards. This is one that they're wanting to hear from after we make our decision today.
what action will they take if we?
Well, I kind of guess it kind of depends on the input that they get from the various school boards. You've had 2 school boards that have enacted mandates without any opt-outs. Most school boards are paralyzed by inaction. We are meeting today to decide whether we're going to go forward with the mandate, with the opt-out provisions. Now, as I understand it, for the students as well as for the employees. Most of the constitutional law arguments that weigh in on the part of the governor, they're not believing that that's going to succeed. But we don't know, as quote, this governor has a penchant for doing his own thing without regard to sometimes what may or may not be constitutional.
Okay. Well, I'm curious because you definitely are taking a different position this week than you did last week, as is Mr. Dye. Have there been any developments that have led you to this?
Okay. What you've just said, I'm going to ask you to specifically refer to the position that I had last week.
Last week, you were unwilling to take on the governor and for us to incur the legal fees to follow that path.
Okay.
And now that's not the motion that we're discussing, but I would just like to know your thinking on your initial motion, which was no opt-out.
Which is not before us. You just
correct.
Okay.
Correct. I just want to know what you're thinking.
Okay, I'm going to support this motion because the majority of the board will not support a motion for a mandate without the opt-out provision. That doesn't mean that I have changed my mind about not wanting to challenge the governor. I don't. But by the same token, I do want the maximum participation that can be had for the children in the district. And that, in my opinion, is a mandate without mask. That does put us on a direct path of opposition to the governor. But as has also been pointed out, the governor ain't no doctor either. He's a political entity that has jurisdiction that, in my opinion, and I haven't asked our attorneys, but I know that our attorney asked the school board attorney, somebody that drafted the not the school board, they asked the governor's office, who drafted the original order, whether or not he thought that that order was constitutional. What do you think he's going to say? Of course he's going to say it's constitutional. I drafted it. Okay. I still think just the opposite. I think it's a very important issue of whether or not we cede to the governor, him saying you can't have a mandate, which means you can't even have a mandate with an opt-out, and then when he gets political blowback, he now says, you can have a mandate, but you got to have an opt-out. Neither one of those is acceptable to me. I'm supporting this because it at least provides more protection than we now have for the children. Because, as has been pointed out, the Department of Health language does not call it a mandate. And I don't want to have any wiggle room, and I don't want to have an argument locally about what we mean in terms of what's in the best interest of the children.
My next questions are for Mr. Dye. statute overrides rules, is that correct?
Are you
I mean,
referring
if you, yeah, I'm,
to the governor's rule?
no, I'm talking about any rule by a body.
Under normal circumstances, but not in an emergency.
In an emergency, the rule has the same bearing as statute? Is that what you're saying? It has the same weight as the statute?
Actually, more weight.
Okay, okay. I didn't know that. Thank you. Okay, and then Ms. Messenger, you're our representative on the Greater Florida Consortium of School Boards. Have they taken any action or any position? No. So they're just all letting us out here all by ourselves, aren't they? Okay. Ms. Saunders, what's the status on the survey?
The survey will be sent out today if that's the will of the board, if nothing changes. Mr. Dye and myself will be working on the questions if we needed to tailor them based on what the outcome of today was. So we are hoping to have it out after lunch today. It will close by Sunday, so that at our next board meeting, the board will have the data from the elementary parents per the questions Reverend Golden gave.
Okay. And in the event that today we vote for a mask mandate with the opt-out, will there be a form going out to parents to make that affirmative opt-out?
Depending on what the board decides today, management will work on the procedure for that once it's over.
Okay. All right. Okay, those were my questions, and I'll probably have some comments, but
Okay, yeah, I've got a few
Thank
too.
you.
Mrs. Mister, and then I'll go.
There's only about public comment.
Whatever you want. We're all over the place. But whatever you want to do. Go ahead. I'd like to address some things from public comment.
Go ahead.
Okay. First of all, Mr. Dean, on your comment, we do have, on transportation and federal funding, we do have guidance coming from the state imminently on the answer to that point that you raised. Next, I was misquoted during public comment. The commenter said, I don't know about the demographics or politics of Manatee County. What I said at the beginning was, I don't care about the demographics or politics of Manatee County. Andra Griffin said that I'm a Democrat. I'm actually like 73,000 others in this county. I'm a registered NPA and have been for, I don't know, 15 years. But if she thinks that's an insult, then maybe I should proudly declare myself as a Marxist-Leninist, and then I can really go wild. Mr. Hyde had a few things to say that were not true. One thing he said, oh, and by the way, board members, just so we're clear, what our board bylaws state is that you cannot support or oppose a candidate for public office. I think he's right. Making the announcement that he is a candidate is not necessarily a statement of support or opposing. Same thing with Mrs. Pratt when she came up and said that she's the chair of the Manatee Democrats. She was not supporting or opposing candidates, so I think that's fair. I think that's fair during public comment. Another thing Mr. Hyde said is that anybody who is here at this meeting or is listening to this meeting is a socialist, so I guess he has just declared himself a socialist. Another thing he said that was not true, he said this meeting was called by me. This meeting was actually called by a board majority. And I wish Mr. Hyde well in another attempt at public office. The mandate with opt-out, I said this many times, but I'm just hoping that we'll see more mask usage. If in a short time we don't, I'll be happy to admit that I was wrong. Duval County, one of my proudest moments as a board member still, was when I made the motion to appoint Dr. Diana Green as our superintendent. And I appreciate Dr. Green's leadership in this state when Duval was the first county to announce that they were going to go with the opt-out option, even before it was announced by the state. So I think the state had to respond to Dr. Green and the guidance that she provided to her district, along with the support of her collective bargaining groups. Let's see, what else? I did want to address, I got this one over email over the weekend, and I think we heard it during public comment, but a few public commenters have raised their objection to keeping kids on a government list by collecting opt-out forms, and I'll talk about that in 1 second. But as far as the school district is concerned, we have a list of your child's grades, we have a list of their attendance, we have a list of their discipline, we have a list of their immunizations. There is lots of lists kept in the school district. So, and that, as the superintendent mentioned, all of that information is protected by FERPA. So there is not going to be any publishing of lists. And then finally, I think I believe if the board makes a motion to direct the superintendent to do something, it's really up to the superintendent to decide how to carry out that directive short of specific instructions, and our motion has no specific instructions. I did reach out to friends in other counties, and they are friends who have opted their children out of mask mandates, and in Hillsborough, there's actually a form that the district distributes for parents to fill out, and a parent friend in Palm Beach County says that in Palm Beach County, all you have to do is just send your child with a handwritten note with your signature on it, and that's all that needs to be done. I do worry about the burden on teachers and administration, but I think if it was as easy for teachers as there's something in focus, just so they can visually quickly, but again, I believe that's up to the superintendent, not the board, to decide how she carries out this direction we've given her. Kelly, if it's ready, can you put that slide up for me? I'd put together some information on a PowerPoint, but I'm going to, for the sake of time, and really, this chart is what I'd like people to take a look at. And it's kind of I think a message of hope. And as you can see, this is from the University of Florida's Emerging Pathogens Institute. And you can see that the yellow line is their projections, and their projections as has been from the start of the pandemic. And you can see how closely actual facts on the ground have trailed their projections. So according to the University of Florida, we are in the middle of August right now, so you can see we're probably just short of peaking out according to their projections. And then, right at the end of August, it's going to steeply decline through the month of September. And so my point here is that if we, as a community, come together, again, as has been stated multiple times during public comment, there is still a parent choice. We are not taking anyone's choice away. But if we can collectively come together, mask up, because I know people disagree with this, but I believe that masks work. I believe they're one layer of mitigation. They're not a catch-all for every case, but with our other mitigation techniques in school, we can kind of reduce that projected curve already. And if their predictions are right, by mid-October, we've now come back to quote-unquote normal status. And I'd like to get to mid-October with as few cases, as few children and adults in our community falling ill as possible. And as I've said before last week, I'm mostly concerned with the status of our hospital, of our healthcare system, and our healthcare workers. There's a report in today's Sarasota newspaper about burnout among our hospital staff and really feeling unappreciated, even though we say a lot of good things about our healthcare workers, but then we don't do anything to actually protect them and take the load off of them. So, like I said, hopefully, it's just a call to let's do everything we can as a community to bring this under control, and we're going to get through it pretty quick. So, I think that's all I have to say. That's going to be my last word for the meeting. So, Reverend Golden, you're up next.
Oh, thank you, Mr. Chair. The only thing that I wanted to lift up, are we still deciding whether we're going to ask the superintendent to do a survey? I thought we crossed that bridge some time ago, in that it is a preference survey that will help us make the decision that we're going to be called upon to make at the August 25th meeting. Because I don't want to make another decision without some data from the parents here in Manatee County. I don't know why there's such a resistance or such a reluctance to want to hear what the parents have to say.
Can I address that, and then I'll come back to you?
Yes, sir.
I think the superintendent, we didn't give her a clear consensus or directive on that. Personally, if it's very clear on that survey that this may not be an option, we just want to know what you think, because I was concerned about parents are going to get the survey, and then a month from now, like, why is my child not in a mask classroom yet? So I think if we can word it in a way that's very clear that we are just seeking information, this may not be an option, I support it.
But I thought we had said that in the last meeting, that this was a survey that was going out for informational purposes. The reality is, we keep talking about parents opting out, and what they have to do. Your actions are going to tell us whether you opt out. Your child will wear a mask or your child will not. Whether we have a piece of paper that backs that up or whatever you're going to do, the bottom line is whether we have the will as a board to say that masks are mandated, and whether that prevails later on with or without an option, as has been pointed out many times, you can't make nobody wear no mask. The question is whether or not you're going to support the board in the decision that we make, and the decision that we're called upon to make today is to wear a mask with opt-out provisions both for employees as well as students. And we're going to be able to support whether that's something that is embraced by the community, by the results from the survey. That's very straightforward. Do you prefer your kid to be in a class with other children with masks or not? Yes or no? And if it makes no difference to you, that's fine too. But all of this hyperbole and hypothesizing and all this that we're called upon to do, we don't have to do that. I'm sorry.
No, it's okay. I just have a suggestion for this. Why not, after the meeting, if the superintendent could just, via phone or email, just reach out to the 5 of us, and if she has direction from 3 to do that, I think we go forward with it.
Thank you.
Is that all? Should we make-
Oh, for him, yeah.
Okay, Ms. Messenger and then Ms. Foreman.
I have some questions for our attorney. So what's being proposed today is a mandate with an opt-out for the students and the employees. Am I correctly stating that? Okay. Is that enforceable?
Yes.
How would you enforce that?
I mean, enforceable, I interpreted, you mean legal.
No.
Oh.
I mean, how can a school enforce that?
I don't think-
How are we going to do that?
Yeah, I don't think the district should enforce it. I think, as Reverend Golden said, if somebody's wearing a mask, they have not opted out.
So I guess, so that's my confusion. That once again, like, there are people that came up and said, well, this meeting's kind of pointless, and I actually really agree with them. I felt like that about last Monday's meeting, because no matter what this board says, it doesn't change the facts that are in front of us. And I get the frustration on both sides. I really have removed emotion last Monday. I'm trying really hard to remove emotion today because I get it. I send my little girl to school. I understand concerns. I understand fears. That doesn't change what's before us, no matter which way you paint it. It's going to be the same thing. You can say it's a mandate with an opt-out, but it's not enforceable. I do agree. There are parents and speakers today that said, well, if a child takes it off, then that's the child opting out and not the parent. I agree with that 100%. How do we differentiate those two is a whole different beast. And I can tell you how I would do it as a parent, and what I would expect from any other parent is whichever way you believe you would like your child to be, express it to your child's teacher. That's the way that you have to handle this, because we creating a mandate with an opt-out does not change how this is going to work in our schools. Whether there's a paper or not, they can come to school, and with or without the paper, it's not enforceable. And it's sad that it's really dividing our community, and I think that's Mr. Kennedy's point, is you want the community to come together and do whatever we can, and I 100% support that as well. But this does not change what's really going to happen in our schools. I would hope, and one thing was that, teachers keeping track, once again, that's something that can be done now. Any parent that wants to ensure their child is wearing one can send a letter today. They don't have to wait for the board to make this decision. They can send it now. They can send an email now. They can contact their teacher now to do those things, to ensure that their child is wearing one or not, whichever way they prefer. Whether you mandate it today with an opt-out or not does not change that. It's just wording, and that wording does not change what a parent can do when they send their child to school. I really appreciated Mr. Choate talking about the different choices, because I do hear there are parents concerned, and I understand why they're concerned. I wish we could offer e-learning again. You know, I also get the point of some people saying, well, look who's being manipulative. Certainly in this job, I see how we've been painted into a certain corner. I can't say that I don't see that. We've had e-learning removed. We've had this removed. We're being told what to do from here. We're being told what to do from there. I accept all those things. I can't change any of those things. When we have the leading public health agency for the state of Florida, the Florida Department of Health, giving us an emergency rule, which, Mrs. Foreman, I'm so grateful that you asked that question about how does that compare to a state law, because I truly did not realize that that supersedes any state law. That is even more enforceable. And in that, it says they must be a choice, that they may wear them. I don't see how this even goes along with the rules that we've been ordered to follow. None of that is my opinion on masks. One person came up and said, well, there's some people that want one and some people that don't. I don't think I have said one way or another whether I think you should wear one or not. That's not my opinion. This is none of my opinion. These are the facts. This is what we've been handed. So do I get everyone's frustration? Yeah, I do. My call to you, if you're frustrated, contact your legislative delegation, because they're basing it off of new state law. Contact the Florida Department of Education. Contact the Florida Department of Health, because it's the Florida Department of Health's rule that we are obligated to follow. Contact them. People want to make this about the governor. I get the governor's a piece of this, but there are a lot of other pieces that go along with it that they're using to base their rules on. So, I will say one thing about the emergency rule that I don't think we've ever talked about, and it's whether you agree with it or not, I do believe that a lot of what the Florida Department of Health's emergency rule and their guidance is based on is a focus on the mental health of this. The way that they have handled things, the way they have written that rule, I think, at least from how I see it, is there is a focus right there on the mental health and how this is affecting our students' mental health. And so I do think that that is part of why they have written things the way they have. And certainly I'm not a medical expert, which is why when we have our leading public health agency, the Florida Department of Health, telling us in an emergency rule what we need to do, I believe that's what we should be doing. So, but with that, I'm going to do the same call that I did last time. And I know that I will upset people when I say this, but this is my own personal opinion. There is a lot of research that shows that if the adults get vaccinated, that the spread to our children will be greatly reduced.
Amen. That is true.
So what I'm asking is, my personal opinion is, that if you want to make sure your children don't need to wear a mask in school, if you want this to end and continue on, then please get vaccinated. Once again, that's my personal opinion. I know that's not where the board necessarily stands, but that's where I stand. Please, I'm asking our adults to get vaccinated, because what's happening right now is adults and children are bringing it into our schools. We haven't seen spread yet, but the best way to ensure that we don't is if the adults get vaccinated. So, and that we all could probably say we stand with the governor on that, because he has said vaccinations save lives. So that is it. Thank you very much.
All right, thank you. Ms. Foreman and then Reverend Golden.
It was stated in public comments how few cases we have. I think somebody said 76. I want to point out that that is the statistics for one day, and 60 of those were students. We had last week a four-day week, and I know there was some strange numbers that the newspaper was unable to really interpret, but we had 182 cases in 4 days. 132 of them were students. If you compare that to last year, we never reached 182 until the end of October. Okay, we started out last year with 8 cases for the first week. By the end of September, we had 70 cases. That's how many we have in one day now. And then we went to 145 cases as of October 23rd. A week later, we were up to 190. We've got some really serious things going on in the schools, and I don't think anybody can doubt that. I had gotten a heart-wrenching letter, we all did, from a parent who has a child who's got high risk, and I'll just read one sentence from it, because that child came to school and by Friday was diagnosed positive with COVID, and she's struggling. It said it didn't take long before she came home from school and said she no longer needs to wear a mask because her new friend at school told her she doesn't need one. She is honestly confused as she looks around her classroom and sees 14 kids plus her teacher all not wearing a mask. She knows that those unmasked students have not been vaccinated. If we take an action that doesn't make a difference today, I'm going to be just as ashamed as I was a week ago when we did not take action. And these cases, they eat me up. I mean, each case is a child. And so if a parent can send a child to school without a mask and say that that is what they are opting or what they are choosing, then I think we should forget that, forget the opt-out. And I would support going all in, which would be a whole different road we need to go down. So we need to make the opt-out work. And the way to do that depends on the schools, the principals, the teachers, to be the enforcers of that. And I'm sorry, I know, I have teachers in my family, and they rejoiced at the end of May when we weren't going to have masks anymore. But this is a different virus, guys. This is way more contagious, and it's spreading. So we have to do something that is going to make a change. One question I forgot to ask is the quarantine. Do we have a number on how many students are quarantined and how many teachers are out today?
No, we do not. Again, the rules are a little bit different than they were last year because, again, the quarantine is being conducted by the Department of Health as well. If you are vaccinated and you are exposed to a positive case, you do not have to quarantine. If you've had COVID in the last 90 days and you're exposed, you do not have to quarantine. So they have all that information. We're not privy to that information. So they are conducting that we do not have the list of the numbers of quarantine. We do have the list of positive, and our dashboard is currently up. Last week, we had a total of 179 cases, and we will keep that dashboard current each and every day. It'll be updated by the end of the day.
Why are we not privy to the number of quarantine cases? And also, don't we know how many people are not in our schools today?
Individual schools have that information because they're working directly with the health department, the nurses and so forth. We do not have a list of that in a spreadsheet. They are working directly with the individual schools or buildings for that. And that's how that is being communicated.
I would ask that that information come back to us. Either if you don't want it on the dashboard for some reason, at least let the school board members know what we're looking at. Do you have a number where if population is down because they're out sick, either teachers or students, do you have a standard for when you will close the school?
We would not close a school due to attendance. We do take attendance every day, so we're able to determine how many students are in attendance or not. HR is able to determine the number of substitutes requested. So we are able to get a gauge of information that way. The only way that we would recommend a closure of a school would be if there was a wide spread of infection, not attendance due to possibly students staying home or quarantining.
That's fair, but I'm
because that really is the last resort when you're closing a school for hurricane or even other situations as well. It has a rippling effect on the entire community, because once we close that school down, it is impacting parents' ability to also go to work. So we don't take those things lightly. But if there was a classroom that we felt needed due to exposure needing to be closed, we do an individual classroom. We've done that in elementary school. If we felt that there was a substantial spread of infection, we would need to address that. But that we would work directly with the Department of Health on making those decisions.
That being said, I just want that we were getting comments in public comment. This is not political. This is not a question about, in my mind, your rights versus the health of a student or a child. And so it's not a conservative versus a liberal. It's not a Republican versus Democrat. This is a humanity. And I am disappointed in anyone that makes this a liberty issue. I can't respect that. I'm sorry. We have the life, liberty, and pursuit of happiness. Well, life comes first. And in my opinion, the health of a child supersedes. So, thank you.
All right, Reverend Golden.
Thank you, Mr. Chair. There seems to be a false equivalency that is emerging in terms of trying to bring about a so-called different view. Florida law clearly says that when you come to a red light, you stop. No ifs, ands, or buts, you stop. But if there's a hurricane affecting a particular area, and the governor orders an evacuation, then those people in law enforcement under the governor's direction are charged with bringing about that evacuation. And one of the things that they do to facilitate that is that they disengage all of the red lights. And what you have to do is obey the instructions of the people who are in charge of the evacuation. The governor doesn't come down and do that. The governor has simply fulfilled his responsibility when the governor says, we need to evacuate because there's a hurricane. I'm not interested in still debating with the governor whether or not there's a hurricane on the way. The people at the NOAA have already determined that, as have the people in the CDC with respect to this virus. What we have to deal with here is whether or not, in the face of this hurricane, you're going to be one of the people that obeys the directions of the people charged with the evacuation, or whether you're going to do what you think is right because it's your liberty. And the reality is that your liberty puts all of us at risk of our lives, and that's not right. And I doubt very seriously if any of us would think twice if we were being evacuated during a hurricane and someone held up a hand to tell us to stop. I doubt very seriously if any one of us would say, oh no, I'm not going to stop because I don't want to stop, or because there's no red light, or because I've already stopped for too many red lights. The equivalency that we're trying to draw here with respect to the rights of people and the duty of this school board is not one that can be drawn. It is the duty of the school board to do what they think is in the best interest of the children in this community, just as it is the duty of that person out there in the middle of that hurricane to try to get people out and away from danger as quickly and as fast as possible. And far be it from me to even insinuate that I wouldn't trust those people who has that hard job of conducting that evacuation. And what I hear today is that a lot of people don't have confidence in our ability to do the right thing. But I thank God, and I do thank God, that my discernment for what is the best thing in the best of children, in the interest of the children in this county, it doesn't depend on what the written law says. If this were normal times, and we were dealing with red lights, green lights, and amber lights, we wouldn't even be having this meeting. This is a special meeting because we're in the midst of a health hurricane, and a decision has to be made. How are we going to react to that? Are we going to keep the red lights, yellow lights, and green lights going and let people evacuate just as if this was something in the ordinary? Or are we going to take the step, the hard step, the difficult step of saying we're going to evacuate and get us all out safely? And I support Mrs. Foreman in the desire that we all try to get out of this as safely as we possibly can. Thank you very much, Mr. Chair.
All right, thanks, Reverend Golden. I have one more question for Mr. Dye, which just came up. So if this motion passes, the board majority is choosing to direct the superintendent to implement a mask mandate with an opt-out. You just,
He has to say yes or no for the record. People in the public.
Glenn, you got to go. I'm in the middle of asking him a question, which he will respond to. Glenn, you got to go.
I'm going.
Okay. If the board majority supports, a motion to direct the superintendent, I believe your job as our board attorney is to find us, the board majority, the legal justification to do that. To say to the board majority, well, you did that, but I recommend that you don't enforce it. Could you talk about the legal strategy behind that?
Well, yes, by enforcement, I mean when a student's not wearing a mask, having a responsibility to investigate that.
That's different than enforcement. You're right.
Okay, and
That's what I was talking about. So
let me give you a hypothetical. Let's say because I think to Ms. Messenger's point, it's really easy with elementary students to say contact a parent. Absolutely, very simple in elementary. In secondary, obviously, they're moving between 6 or 7 teachers a day. So for a secondary teacher, and I'll repeat again, I think this is the superintendent's duty to fulfill how this is carried out. But a secondary teacher, when they open their focus at the start of class to take attendance, can just look down and see a notation, this student has an opt-out. So they can, in the context of their own classroom, and I'm not saying that we become Big Brother, but at least a teacher who is interested in it, and maybe a teacher who's not interested will still take a look and be like, and can walk over to a child and say like, or a young adult and say, could you please put a mask on to them? That to you is enforcement?
Well, to be the devil's advocate, what if you have the opposite, where a parent doesn't want a child to wear a mask, but you notice the child's wearing a mask? Would you take an action in that instance?
That could certainly be up to the classroom teacher. I'm still not sure I'm just trying to dig into like, what is the enforcement?
Well,
we need you to give us the justification to do what this board wants to do.
By enforcement, that suggests punishment, and you become the police of mask wearing.
But you're crossing a bridge we haven't come to yet.
Well, I wasn't trying, I just was trying to respond to the question.
Okay.
So the opting out is one step, but enforcement is starting to monitor each of the children, and if they're doing what their parent requested.
That's what the superintendent should be doing.
Yeah,
Reverend Golden, could you say that again so we don't have a sunshine violation? Could you repeat what you just said?
Yes, and that's what the superintendent's job is.
I agree.
Our job is to simply say that there will be a mandate and that there will be an opt-out. And if we are going to keep paying her this humongous salary that we pay her,
We're going to lose that.
yeah, we're going to lose that. Right, that's right. We're going to lose that.
We're going to lose the equivalent.
Yeah, the equivalent of that. Then let her figure. That's her job.
And Chairman, I would recommend that as well.
Yeah.
Yeah. Okay, we're on the same page there. Okay.
And I apologize for speaking under my breath.
Got it. I mean, Mr. Gibolino's right, even though he had to leave. We do need to be heard at all times by the audience.
Just real quick.
Absolutely.
I'm sure this is maybe something that superintendent can figure out with all the other, how to actually carry out. But MTC is something that's that I've gotten an email about. Mostly adults. Do they even need? So I know obviously this is encompassing all of our campuses, but now we're telling, grown people. So I don't know. Again, that maybe fall under the mask mandate with an opt-out, I'm assuming, like everything else. So we're going to ask a 22-year-old to bring a piece of paper that says I allow myself to not wear a mask. Do you know what I mean? So I don't know. It's just email came up.
Yeah.
Just a thought.
Mr. Choate, that's a great question. I think what this motion does is allows the superintendent to, with the employees that are covered under collective bargaining, is that she can work with
the director,
Ms. Barber and Ms. Howell, and they can work out those details of how that goes. Mr. Dye.
Yes, Chairman, I think you're aware of it, but points of order are not proper from the public. They're just from the body itself.
Absolutely. That's why he had to go.
Would you go get Gibolino and bring him back in then? Is that your point?
That's not my point.
That's not your point, okay.
I'm sure we will see him next Tuesday. Next Tuesday at our next meeting. All right, we have nobody else left to speak. We've got a motion and a second. All those in favor, please say aye.
Aye.
Aye. All those opposed, please say no.
No.
Okay, motion carries 3-2. Superintendent Saunders, do you feel like you have enough direction to proceed from here?
Yes, I do.
Okay, excellent.
I have a question that I would like to ask. Do you feel you have enough direction now to proceed with respect to the wording of the survey that we would like to have from the parents? We keep saying we want to hear from the parents, and we keep putting it off now. I'd like for us to have that information when we come back on the 25th. I think the promise was that we were going to do a survey through the 10-day the 10-day count, and I don't know how far into that we are, and I don't want to extend it beyond.
It's this Friday. It's a 10-day, or actually it's Monday. It's a 10-day count.
Monday.
then can we, do we need to give more direction in terms of that, or are we still ambivalent about whether we want a survey or not? Because I think that in light of all that we have heard, we need to know the parents that would prefer to have their children in a class with masks, the parents that would prefer they not, the parents that it doesn't really matter.
Reverend Golden, Mr. Dye and myself will be working on both of these items when the meeting is finished. I will contact, as the chair suggested, each board member to let them know what the survey says to make sure we're capturing and everyone feels comfortable with the clarity of the questions. My suggestion is that we end the survey on Sunday. For the most part, within a week, we're going to get the bulk of a response of a survey anyway. That gives us time on Monday to compile the information so that I have it available for our board meeting on Tuesday. And again, the survey was directed to elementary schools.
Yes. Do we need a motion to direct the superintendent to do that, or do we accept that? I have no problem accepting that as a course of action.
Yeah, I think she can, you and I have expressed support. She can contact the other three to get their feedback once the questions are written. And then obviously they'll come to Reverend Golden and I too, and then we can go from there. Mr. Choate?
Just a quick question about the dashboard and the information we're getting. We've obviously seen like the daily count, hey, here's COVID count. Do we get any information when students come back from COVID? Is that then put in anywhere saying, hey, we had 177 Friday, but today 20 kids have come back with positive or negative tests, so now that number's subtracted?
Those are actual positive cases, not symptomatic or quarantine students.
So do we have that number as well?
So
we're showing both sides.
That would just be regular illness, and that would be calculated in our attendance code, and that they've returned just due to illness. I will tell you, we have had situations on Friday where it was documented where students have migraines. It's in their health record. They were directed initially to go get a COVID test, but once the parent brought it to our attention and we looked into it, if they're symptom-free, they certainly can come back without a COVID test because they've got other medical issues. So that goes back to what you're saying. We do not put that in the dashboard. So the dashboard will be updated every day, and it will we'll keep a total. So you will know how many cases were positive today, and so you can see a running total. Regular illness and so forth, that will not be on the COVID dashboard.
But what I'm getting at is like you're running total, adds and subtracts daily because we come in of COVID and out of COVID.
You're correct.
I mean, the actual student.
Right.
So the number we had Friday is all in likelihood not the number because it's going to be adding and subtracting from that.
Well, if you look at the new cases for the day, you will see that is, you take that out of the grand total. So you will know how many just that day came in positive, but it is part of the total number. So if you look at the dashboard right this second, let me see, let me pull it up.
By the way, for the public, our dashboard is manateeschools.net/COVID-DB as in dashboard.
So if you look at our header, it says new cases, that would have been a Friday, student cases since the beginning of school, staff cases since the beginning of school. So if you go down to the bottom, you need to add up the student cases with the staff cases, which is going to give you 179. You are correct. You need to subtract out 68. The 68 are embedded in that total number. But that just shows you that Friday, how many were positive Friday out of that total number of 179.
Okay.
And the reason we ended up changing it through the year into that format is because we have 180 school days. We won't have enough space to scroll down. So this was a condensed way so that you could keep a total daily and then see the impact of the students and by school or building that way. So I hope that kind of answers your question.
Okay, good. All right, I just want to make one comment too, that this is not part of our dress code. Let's be clear about that. This is a direction of the superintendent to carry out a directive. This is not a policy change. It's not in our policy document. But I think as far as the, our teachers are, this is not a piece of the dress code, but they do stuff like this all the time. And so, again, it is a separate issue, but I think our teachers can handle the load. Like I said, with that graph, hopefully just for a few weeks until we get out of this, and then we can take a look at taking them back off again. But
Sure.
Yes, ma'am.
We're going to have a meeting on August 24th, and I assume that that's when we were going to take up the question of whether extending this or not. And I would suggest that if that's the case, because we are going to have to consider whether on the 25th, whether it needs to continue or not. I would suggest we do it in a separate meeting, just because of the amount of time. That's going to be an evening meeting.
Let's see, today's Monday. If we're going to do a separate meeting for that, we still have time to, we could hold a one-item meeting on Wednesday, because that's the 25th. I think that's a good idea, and I still have time to get to this with the superintendent, and Amanda would still have time to publish.
Although I'm getting kind of fond of these Monday morning meetings. That's a joke.
So let me follow, that's an interesting point. Let me follow up with the superintendent on that.
Thank you.
As chair, I will do that. Thank you. Anything further? I appreciate everybody who came out today, the superintendent and her team, who only in addition to the stress of opening school, this stress as well on top of it, which to me feels even more stressful than last year. But board members, I know it was not everybody's choice to be here, but we got together and we did this with respect for each other, and the community showed respect for each other even in differences. And to our law enforcement brethren, thank you for being here. Hopefully we'll get past this soon. And that said, I hope everybody has a good week to a school. We're adjourned.